Good morning, my lord.
Good morning, Mr. Caskey.
I have a witness today, Mr. William Jolly.
Very good. Thank
I'll
you.
ask for him to be brought in just now.
Please.
Want one? Want a water? Yeah, okay. Have a seat, Mr. Jolly. My lord, this is Mr. Jolly. Are you able to see us?
Very good. Good morning, Mr. Jolly.
Good morning.
Mr. Jolly, would you tell us your full name, please?
William Gray Jolly.
And we're here to discuss the events leading to the deaths of your father and mother.
Yes.
Your father was born on the 19th of July 1931
Yep.
and sadly passed away on the 26th of April 2020.
Yes.
Your mother was born on the 29th of January 1933 and died in September 2020, is that correct?
Yes. I'll say yes.
You tell us a bit about your father and mother at paragraphs, or your father and mother at paragraph 5 and your father at paragraph 6. Can I ask you just to read those in the first instance?
Paragraph 5.
Yes.
My mother and father had been together since my mother was 14 years old. They had been together for 72 years. My father was a manager of a Scottish Gas retail showroom in Aberdeen, and when the showroom closed, my father took a job as a meter reader to taking him through to retirement. He retired when he was 60 years old.
And paragraph 6?
When my father retired, he did a lot of voluntary work, Meals on Wheels. He worked for Care and Repair, which was a voluntary organisation. He was, for a spell, the caretaker of the British Legion Hall. He kept himself very busy. He was a born organiser, an active member in the community, and my mother helped him with the Meals on Wheels. She joined a walking group and had her own interests.
What was your dad like as a man?
A bit like me, opinionated probably. He was a good father. He looked after my sister and myself, and he worked hard all his days. He had 2 jobs at one point to support the family.
And your mum?
My mother worked as a home help. She thoroughly enjoyed her work because she was helping other people in a part-time job, and she retired, I think, possibly in her 50s.
You say at paragraph 7 that your father suffered from vascular dementia.
Yes.
And your mother Alzheimer's.
Yes.
Briefly, can you explain the differences in the effects on those conditions?
I think that the best way to describe it was we were aware that my mother had Alzheimer's or had some kind of memory problems, and my father was covering for her for quite a while. My father had vascular dementia, and the difference was that my mother became very introverted and changed personalities, whereas my father was still, if you were to meet him, you wouldn't immediately say that he had vascular dementia, because he was still very active, reading newspapers. He kept up with current affairs, and you could have a fairly normal conversation with him.
But they both had those conditions. I think
Yes.
your father, and you detail this to an extent at paragraph 8, that your dad had
Yes.
other health problems, and your mum also presumably by that age would have had health problems.
Yes.
You took out a power of attorney.
Yes.
Is that exclusively in your name?
No, my sister as well.
And then you say at paragraph 10 that in 2015 effectively they moved house.
Yes.
How long were they in that house, the new house?
In the sheltered housing?
Uh-huh.
Well, I've got here about 3 years.
Right.
They were in sheltered housing.
And why did they go into sheltered housing?
They were struggling to support the lifestyle they had in their previous house. And we convinced them, well, I think my mother had a couple of near incidents on the stairs. They had a staircase in their previous semi-detached house. And we managed to secure, with the help of a care manager, to get them into a sheltered house that was a 2-bedroom semi with a driveway and no stairs. And they were both very, very happy actually to move. And the other thing was, it was monitored. They had panic cords, and latterly they were wearing devices that if they had a fall or anything happened,
They could press the button.
you could get a local caretaker, which was just a matter of about 100 yards away to react.
Whilst they were in that sheltered housing, their conditions deteriorated.
Yes.
You provide a specific example of that around about Christmas Eve 2017.
Yes.
Can you tell us what happened that night?
My wife and I had intended going into my son's in Aberdeen for Christmas lunch and intending coming back, you know, the same day. And my recollection is that my mother and father, although they weren't particularly concerned, there was what's going to happen to us came into our minds. So we decided to cancel our arrangements and told them we would produce Christmas dinner for them and we would come down. That started an epidemic, is the only way to describe it, of phone calls.
How many do you reckon there
Over
were?
200.
Over 200
Yes,
phone
in the
calls?
space of about 36 hours. I actually printed them off. I think I've still got them. My mobile phone rang virtually non-stop, and the house phone, and despite me even going down, my mother would phone, and she couldn't remember why she'd phoned, and then she told me my dad had told her to phone, then my dad would start phoning, and that went on from 8 o'clock in the morning till 11 o'clock at night on one day.
How far away did you live from them?
At that point in time, we probably lived within maybe half a mile.
And so did you go round?
What we decided to do was cancel. We cancelled our lunch and we went to Marks and Spencer's. I'm not advertising, but we got fast food Christmas takeaways so we could put in the oven, and my wife and I went down. My father wasn't impressed that we'd arrived for Christmas dinner, but my mother was. So between the two of us, we spent Christmas, well, about 3 hours with them on Christmas Day.
Was that an isolated incident? Was that a complete one-off, or did that fit in with a pattern that was developed?
No, there was a pattern of failures developing. My mum and dad would get lost. I think at that point in time, my father was still driving, which was extremely scary for us.
How was it for the neighbours?
More scary. I was getting phone calls that my father had nearly hit somebody, that he was driving, he arrived at my house, he was lost, he couldn't remember where he stayed. Anybody that's dealt with this will understand. I went to the police said that there's nothing they could do. You know, had he been advised to stop driving? And I said no. Well, what do you want us to do? And I said, well, you know, my fear is it was going to be an accident. And my father didn't see this. And as you know, I always look at it as if it was my son telling me that I was no longer fit to drive. He got into quite a rage about me saying, you know, that something was happening with the driving.
Yeah, I think doctors were involved in 2 occasions in relation to your dad's driving.
Yes.
Tell us about the first time.
Well, that's sectional. I kind of have to refer to some of the notes. Well, what happened was we had spoke to the doctor about my dad, and they decided that he would see a geriatric consultant from, am I allowed to say the place?
Yes.
Cornhill Hospital in Aberdeen, and an arrangement was made. So I got my father to drive me down to see how his driving was, and it was a scary experience, but he was, you know, he was okay. We got there, we saw the consultant, and although it sounds like a comical thing to say, because my father was so up to current affairs, he spent his time watching news programmes, TV, reading newspapers. I think he got 26 questions, and a lot of them were current affairs. And as I said in there, and I'm not joking, I think he got a better score than me. You know, because he was really, you know, into current affairs. He's spent all his time reading the newspapers.
So in that assessment, he
passed.
And you failed.
And I probably would have failed, yeah, I had to give up my car. No, but I mean, that's what it felt like. But to let you understand, it wasn't a pleasant experience, because my father was extremely angry with me. And when we got back out...
Because you were trying to take his driving licence?
It was ha-ha, I'm still able to drive, and we drove back home.
Was there any suggestion at that first meeting about a brain scan?
I recollect that it was suggested that he maybe need further investigation, but he refused. And that was accepted.
Okay. Now you move on, paragraph 12, and as it's helpful to you, I'll refer to the paragraph numbers. And you talk there about him getting lost.
Yes, I'll just take a drink of water.
Sure.
Drying up. Shake it.
There's no need to shake.
Recounting this is not easy.
No.
My father was back driving, walking out and getting lost.
You don't need to read it, just tell me what it's about.
Well, what we were finding was the pair of them were going out sometimes and getting lost, and quite often it would be my father. And my father was still driving around town. And on one occasion, I was in Aberdeen, and he arrived at my house, and fortunately, my wife was there, and he was in a real state. He couldn't remember where he lived. We found out subsequently he'd been driving around Ellen looking for his house. He'd been seen at his original house. He'd been seen driving down the main road a couple of times. And our house at that time, we had a substantial garden. You couldn't see the main road from our house. And how he found it, I don't know, but he came to our door and he didn't know where he lived.
And you were in Aberdeen at this point?
I was in town at the time, yes.
Was there anyone in the house?
My wife spoke to my dad and gave him basically directions to get home.
Right. Was there then further contact with the doctor?
Yes. Fortunately for us, a doctor who is also a neighbour was the doctor when my wife made a phone call, because by this time it was affecting my health. I was getting extremely stressed. My blood pressure was getting higher because I was dealing with a situation that was rapidly getting out of control. So my wife had phoned the health centre, and the doctor who we knew, she told my wife to get myself to take my father down to the doctors that afternoon, and I did.
And what was the outcome of that meeting with the doctor?
The outcome was excellent, because the doctor that I saw, who has a reputation locally for being a no-nonsense, old-school type of doctor, when I went in with my father, he related what we had discussed, the fact that my father was getting lost, he couldn't remember where he was, etc. And he said, I see in your notes that you declined getting a brain scan, and I feel that there is memory issues. And he said, that's correct. And he says, well, you won't be driving until you get a brain scan.
So effectively the doctor took his licence off him?
and the consequences for me, apart from what happened outside the GP unit and what happened latterly, were horrendous.
In what sense?
Well, I then had to drive my father home and take his car away from the house because I knew that he would either forget or the temptation would be too much and he would resume driving. So I told him that I would take the car away until he got the brain scan. And the car that I used was, he said, what was going to happen to my car, which was, by the way, virtually valueless. It was an old car with a week's MOT. And I told him, I says, well, when you get your licence back, we'll look at getting you a new car. So I took the car back to the house and I disposed of it within a week.
Did that mean you became the chauffeur?
Absolutely. Much to my, well, I wouldn't say shock, I suddenly realised that I had a predicament because my sister lives down this way, so it wasn't available, and I was always the focal point for anything that went wrong in their house. And I mean, I've had flooded kitchens when they forgot to close the door with towels sticking out. The list is endless. So I was their first port of call.
Did their personal care, cooking meals and things like that, did that deteriorate?
Yes. There was then a fairly rapid deterioration, much to my shock, and thankfully with my wife's support, we then started the initial caring process, which was embarrassing to speak about really, but their bed hadn't been cleaned in I don't know how many months. We actually disposed of all the bedding and went into town and completely refurbished everything, duvet, covers, which was so unlike my mother. My mother was always meticulous, and my father was known for wearing, of that age group, an immaculate combination of clothes, unlike me half the time, that even my father was always well dressed. We could see it going downhill.
By this stage, were you thinking about a care home?
Well, there was more went on after that, before the care home. I mean, the care home was the next step. We didn't know how we were going to get into that mode. So probably for the months leading up to the final situation where we had no option but to look at care, my wife and I were both extremely stressed and distressed because, for instance, on one occasion, I was taking my father to the dentist because he had no car. When I got down there, there was nobody there. So I'm now looking around the village, it's a town, small town, looking for them. And I found them huddled in a shop front in the pouring rain. They couldn't remember why they'd went out. And that's the kind of thing we were facing on a regular basis.
So you moved on to consider a care home?
Yes. We had a discussion and we thought that, it's the same with if anybody's dealt with this situation, bearing in mind it was both parents at the same time, it was also that they weren't eating properly. And we were aware that my mother was almost vegetarian, believe it or not. She would only eat chicken or small bits of fish, but she didn't ever eat meat. She was eating anything, and that was a first shock for me. And we had to get a private company in to supply, Wiltshire Foods we used to supply food and try and get them trained into using a microwave oven, which we often had to supervise. Did
you contact the local authority about care home? What was their attitude? Were they supportive?
Well, the other thing that happened that's been missed here is that they had carers coming in. We managed to get visiting carers. But
how often would they come in latterly?
Initially it was once, and then it was maybe 3 times a day, I think, because we couldn't guarantee that they would be in the house, and we couldn't guarantee that they would be willing to let them do anything. But we found out that they actually weren't letting carers do anything. They were virtually going in, chatting to them, having a cup of tea. My mother wouldn't let them do anything. So it came back to my wife and I to be their main carers.
And
Mr. Jolly, can I interrupt Mr. Caskie for a minute?
Yes.
This is really just to help you. It may not help you, but I hope it does. I've seen you've been understandably a little bit emotional at this. can I say that within the past 10 years, I have been through exactly what you have described with my now late mother.
Okay.
And therefore, at least so far as I'm speaking, I'm concerned, you're speaking to an audience who completely understands.
I appreciate that. Thank you very much. Thank you.
So you spoke with the local authority, and did you speak with the local authority about a care home?
We did.
And who selected the care home, and how was that done?
Again, because I was my mother and my father, we had an issue of getting them both into the same home. We went to some care, my wife and I toured a couple of care homes that we wouldn't put anybody into, to be honest with you, and I think anybody that's visited care homes will be aware that there's variations in the quality in the care and the quality of provision within the buildings that you see. The hardest part was, well, in fact, what we did come across was that there was a possibility they might have to be separated, which I said would probably end their life very, very quickly, because my mum and dad were never seen without each other, and it was they were known in the town. You would never see my mother and father out alone. Very, very rarely.
Joined at the hip.
Yes, that's the best expression. Yes.
So, did you find a care home that could take them? Well, firstly, did you initially find a care home with a double room?
Well, there was a couple of problems. We were hoping to get them into a local care home. That wasn't possible. It had to be a place that had support for dementia, so it had to be like a nurse in effect as well, I think you would call it. The care home that fitted the bill that we could get 2 rooms in was, can I name that?
No, let's just leave it.
Okay. The care home that we were offered was fairly remote, in that it was probably about, 30 miles north of where we lived, and that caused problems for visitors getting to the place. And they offered us 2 rooms, and we went to see it, and we thought, okay, we can maybe do something with this, even though it's in a location that wouldn't have been preferred.
Did you have an expectation of the quality of care that your mum and dad would receive? In terms of, I don't mean physical care, I mean activities and things like that.
Yes. Anybody that's had any dealings, and again I come back to this with care homes, will see the glossy adverts and the glossy brochures and the stuff you see on the internet, but when you're actually dealing with them, you find that it doesn't quite meet your expectations.
You say at paragraph 21 that after a period you came to the conclusion it wasn't meeting your expectations.
I think one of the things that happened immediately my mother and father went into this particular care home was that, and this is actually quite shocking really, because we found out from staff that because my mother and father had been together all their days and slept in the same room, even though they were in their 80s, that they were given 2 rooms and they had single beds in each room. What was happening was, we found out from a member of staff, my father was going through into my mother's room and topping and tailing in the same bed, which were horrified, and they couldn't stop him. He just would not stay in a bed in a room on his own, knowing that his wife was next door, my mother was next door.
And he had vascular dementia.
Yes.
Now, at that time, your children, you have children of your own, yes? Where were they living?
They were in Aberdeen.
And did your children have children? Did you have grandchildren?
Yes, I've got grandchildren, yes.
Did you want to move down to be with your children, closer to your children and grandchildren?
If I can go backtrack slightly here, back to the care home they were in. We did eventually, but with apply, we did, I don't know if it was a health and safety reason, but we said this is not sustainable. We can't have this happening with my dad. So they agreed to put 2 beds into 1 room, and because they were paying for 2, they were self-funding at that point, they would allow the second room to be used as a small sitting room in that particular care home. So that stabilised things for a while.
So you then decide, am I right in saying you then decide to move closer to your children and grandchildren to move to Aberdeen?
Yeah, I mean, I came from Aberdeen originally. My wife, the country girl, I decided that it would be easier for us to live nearer my son and daughter-in-law and grandchildren in Aberdeen. And it would mean that because the care home that we landed up going to was extremely handy for them, that my mother and father would get more visits.
And did you change where you were living at that time?
Yes, we decided to sell up in, I would say, with a desirable house at that time, with nearly an acre of land. We're in the middle of town, and we put our house up for sale during lockdown, and lo and behold, it sold. So we were in a panic. We managed to rent a house in Aberdeen until we decided what we wanted to do. So we moved into Aberdeen.
You've already said that. How did you find the care, what I'll refer to as Care Home 2?
Care Home 2 in Aberdeen. We were delighted with it. It was totally different. Best way to describe it is it was like I always thought it was like a West Coast Victorian hotel. It was a former private club.
Sorry, just carry on.
Okay, which had substantial public rooms. It even had a bar, which was, you know, when my father saw that, he couldn't believe it. And they'd retained the bar in the corner, and they used to have residents as being barkeepers. I mean, it was the kind of place that if I landed up in a care home, I thought to myself, my wife did, this would be the place for me. And the restaurant, and it was a restaurant, it wasn't just like the previous place they were in, it was like a canteen. No, it was just formica tables, chairs, and, you know, they were on an upper floor. There would only be about maybe 6 or 8 people dining, whereas in the one in Aberdeen, there was a proper restaurant, and it felt like a restaurant. And my father's biggest worry when we did move them was, how are we going to be able to afford this? Because they went from, you know, a fairly standard, very small care home bedroom to a double room with a bay window looking over the garden in a Victorian property, which was, you know, they couldn't believe it.
They'd landed on their feet.
Yes, oh, they were delighted, yes, and so were we.
Social activities in Care Home 2?
We noticed a complete change. Care Home 1, the things that were advertised, we found weren't happening. As far as I'm aware, in the time they were there, they had maybe 1 bus trip because they did away with the bus. So what we found was, and I think I've got it on my statement, what we found, we were going up randomly, I would say 3 times a week, maybe more. I would go up myself, go with my wife, and I would find my mother and father in a small room with the door closed, the heating off the clock and the TV on, sleeping. Both of them sound asleep, and that could be 10 o'clock in the morning, 2:30 in the afternoon. So I got the feeling that they were an easygoing couple, and they were easy to deal with, and they were left to their own devices.
And what about Care Home 2?
Care Home 2, they had a different attitude. We were told by the care home manager that we were introduced to when they moved in, that they basically, I wouldn't say didn't tolerate, but they very strongly didn't encourage residents sitting about in their rooms. So, and because they had to go to like the far end of a substantial building for their breakfast and things, they used the public areas most of the day. And in there was arts and crafts, there was my father, there was newspapers delivered, there was a controlled TV area.
Did that make a difference
Absolutely.
to your
Yes.
parents' mental
Yes. Absolutely, yes.
acuity?
We were happy in there, yes.
Visits, how often would you get in to see them?
Well, that was a problem. We saw them a couple of times, and then, as I said in my statement, I unfortunately landed up with a severe gastroenteritis thing.
I'll pause you there. We'll come back to that.
Right.
You said that you had a child who lived close by. Was he able to get in at that stage?
My granddaughter.
Yeah, sorry.
Yeah. Well, yeah. Well,
Your Aberdeen children.
Yes. Well, the advantage of the situation where they were then was that it took pressure off my wife and I, because my son and daughter-in-law and grandchildren could visit them because they were so close. And in fact, my mother was delighted, well, both of them were delighted when the local school choir, and they used to have a fairly regular, we actually saw dancers coming in there, you know, kids dancing. And anybody dealing with people with dementia will be aware that when we took the grandchildren up to the original care home, it lit up the place. You know, older people were delighted to see youngsters. And some of these people in there never had visitors. And that's the crying shame of it. We used to actually go and sit with other, you know, like I would leave or my wife would leave and go and sit with other people that Saf told us never saw anybody. And we actually had a couple of sort of like adopted elders that we would visit.
We're talking about Care Home 2 now.
Care Home 2, yes, I'm off my tangent there. Care Home 2, yes, my mother and father were delighted that the local school choir arrived, and my granddaughter was one of those singing. So it was a different environment completely.
Now, I'm going to use a formal word that you don't use, but there seems to be a kind of induction process into Care Home 2 where there's a 6-week review.
Yes.
After they've moved in.
Yes.
Can you tell me about what happened at that 6-week review from your personal experience?
The 6-week review...
Were you there?
Yes.
Right.
I was there, my wife was there, my sister, the care manager from Aberdeenshire Council was there. And oddly enough, as was noted by, again, I've got to be careful here, noted by the council care manager, the actual home manager didn't appear at the meeting, which she noted was quite odd.
Did you have a health problem around that time? Did you have gastroenteritis?
Yes, I had gastroenteritis, quite a severe bout. I don't know where it came from, and I was advised to stay away for a few weeks from the care home.
And did you do that?
Yes.
So what happened at the 6-week review that everyone was apart from the management of Care Home 2?
Well, we all agreed that everything was going okay. My mother and father were very happy, and we kind of retired back to the sort of private lounge for the residence lounge, and that was the last time that I saw my dad.
Sorry?
It was the last time I saw my father.
How soon, because I think that meeting was on the 10th of March.
Yes.
When did lockdown happen for that care home?
I don't know. I do know that, I think it's in my statement, that my father had quite bad eyesight, and he always spent a lot of money on glasses, and he always wanted new glasses. And I'd arranged to take him to the opticians, and I think it was on the 17th I put down. My wife's got a fantastic diary. And that, I was told, leading up to it, was on hold because it was likely there would be locking down. And in the end, I had to cancel. I didn't get to take my dad out of the care home because of our lockdown.
And you have a record of that appointment being cancelled?
Yes.
Yes. Okay. I'm now at paragraph 39 in your witness statement. Now, throughout the witness statement, you've referred to a series of your father suffering a series of falls.
Yes.
And this is the first one that's referred to. What injuries did he sustain on the 6th of April 2020?
Well, I think that was the one when he had banged his head, or, you know, he had some kind of head injury.
So
And I
this
was
is
told
paragraph 39.
that I was told there was nothing to worry about. You know, it was dealt with.
Okay. Was he using a stick?
Yes. Part of the aging process, having used a stick myself for having repairs to my knees, it's not the nicest things to do. And my father had to be coached to use a stick, and he was actually starting to use a stick because he was a bit wobbly on his feet and his legs a couple of times, and I had sort of coached him into thinking, along with the staff, that he should be using a walking stick when he's out and about, just in case he fell. And I think, ironically, on there I did say, if you don't use a stick, you might land up in the hospital, which, you know, you laughed. It's the kind of thing you say.
Paragraph 42, you talk about him getting a urinary tract infection and becoming more confused. Was his health at this stage deteriorating? At this stage?
Yes.
And then at paragraph 43, you talk about the 11th of April,
Yes.
and that's fall number 2.
Yes, well, I think he had a couple of falls. On his records, I think there might be others. I mean, it was notified on his records that when he was in the hospital, he had old injuries that I'm not sure if I'm aware of them.
Sure. Well, we'll stick to the ones
Yes.
in your witness statement.
Yes.
So this is fall number 2,
Yeah.
11th of April. And the description of the injuries, bruised, had a lump. Nurse had a look at it and it wasn't deemed serious.
Yes.
That's accurate. 44, later the same day,
Yeah.
next fall number 3
Yes.
in your statement.
Yes.
Tell us about that one.
Well, best to read it off. It was later that same evening, Saturday, 11th of April, I got another call to say that my dad had had a second serious fall, hard onto the rear of his head, and there was significant bleeding. That was at 11 o'clock at night. The care home nurse that phoned me was extremely distressed, and understandably, because I was told there was a lot of blood, and my mother obviously was involved, and I can imagine her being equally distressed. And I said there that she was obviously in shock because she was dealing with my mother, who was also extremely upset. She said my dad was bleeding heavily and had been blue lighted by ambulance on his way to the hospital. Can I mention the hospital?
Yeah.
Aberdeen Royal Infirmary. And I put a note on there because I found out it was an item that I was asked, and that my father was on blood thinning medication, which maybe indicates why he had a
So much
substantial
blood.
bleed.
So
Yes.
much blood. If he was
Yes.
on warfarin or something
Yeah.
like that.
Similar, yeah.
And then at 45 and 46, you explain that you couldn't get into the hospital.
No.
You called them numerous times.
Well, when I spoke to the nurse in the home, she says, you'll have to go to the hospital, but of course I knew I wouldn't get in. So I was phoning, trying to find out what was going on. And then I say that 1:20 in the morning, I knew, I've got to say this, I knew that it wasn't going to end well. I had a feeling that this was going to get worse. So I kept a pretty concise, precise record of what was going on. So 1:20 in the morning, I found out that my dad had been taken to X-ray, and I believe they said he was going to get scanned. It was head injury. Mm-hmm. I was told to call back around 6 in the morning, which I did, and I was told my dad had had a CT scan, and his results would be given to me later, and he had been admitted to Ward 105. Yeah.
You then say that when your dad got to the hospital, he'd had a full bladder.
Yes.
This is the first hint in your witness statement about any concerns about the care provided in Care Home 2.
Yes.
Was that, at that stage, something that was unusual to...
Well, I just found to be told that when my dad arrived with his injury, that they discovered he had a full bladder and he had urine retention, and they had fitted a catheter. And I did think to myself, well, why did the care home, you know, he'd had a couple of urine infections, why didn't the care home notice or consider he had a full bladder? Because they do fit catheters in care homes.
Did they test him for COVID when he was admitted to the hospital, as far as you're aware?
Well, I think I need to go to section 49. Because, well, it says here I called Ward 105 at 8:10 to be told my father would be tested for COVID-19, and they were waiting the results. Now, the nurse that I spoke to said she was very confused as to why he was COVID tested, because he didn't qualify for a COVID-19 test. And I pointed out to her that it was just as well, because I'd been advised by the New Start care home manager the previous day that they'd had a recent COVID-19 positive resident who had been taken in and then sent back to Aberdeen Royal Infirmary. So there was COVID in the care home.
Now, we'll do this bit carefully, Butch, because it mentions a lot of names.
Okay.
Okay?
Yeah.
Prior to this, there had been a female manager in the care home, is that
Yes.
correct?
Yes.
And that changed, and there was a male care home manager. How did you find out about the change?
Weren't told directly by the company. We found out, I think, through a member of staff, and had a conversation with the New Start care home manager.
And did you find out what his level of experience was?
Yes. He had never managed a care home before. He actually told me, but then it's difficult, I've got to be careful here, but I wondered why in the things that happened afterwards there wasn't a deputy care home manager, but we were led to believe that wasn't necessary.
You say in your witness statement twice that he was inexperienced and was hung out to dry.
Yes, and he thanked me for that.
Thanked you for?
Saying that to his superiors.
Why did you feel he had been hung out to dry?
Because the level of experience that he had in being faced with the most horrific situation, and occasionally a mentoring manager coming from another care home, which had far more serious outbreaks of COVID as it transpired, was the only thing he had to lean on. And the other thing was that his area manager, who I had dealings with, was very difficult to contact as well. And when this particular new care home manager was off ill, I don't know if I'm allowed to say, but we found out he had COVID, we were given this particular lady's phone number if we couldn't get information. And I had phoned the care home before, and because this is, we're speaking about before my father came back or after?
Your dad's in hospital at the moment.
Right, okay. So this bit I'm talking about now is after my father returned.
Then we'll get back,
Yes.
we'll get to that.
Yeah.
Try and keep it chronological. Let's go back to the hospital.
Yes.
Did the hospital inform you, they said that they had carried out a COVID test.
Yes.
But you also had a conversation with them on the 12th of April about decision making.
Yes.
Tell me about that.
I was told that they were taking over any decisions, because I was obviously extremely concerned about what was happening, struggling to get information. And I don't know if you're talking about before or after my father had falls in the hospital.
No, before.
Before. I was told that they would be taking over my father's decision-making processes, and that my power of attorney was deemed irrelevant. Because I said, well, I've got power of attorney, and they said, that's irrelevant. We are taking command over your father's decision processes while he's here. So I was put in my place, basically. I was probably a bit irate, but I felt that I'd been put in my place.
And how did you feel about the removal of effective removal of the power of attorney?
Well, I just had to accept it because I couldn't get into the hospital and nobody would have contradicted the decision that was made. I was led to believe it was, well, indirectly, as I've said, that the hospital, I was led to believe, were acting on government instruction, and that went as far as when my father was sent back to the care home.
Now, this telephone call, according to your witness statement, I think, took place at 11:25, looking at paragraph 51. And then if we move on to paragraph 53, you get another phone call on the same day,
yes.
6:20 in the evening.
Yes.
Tell me about that one.
Paragraph 51.
53.
53.
Don't name the nurse.
Yes. Well, leading up to that, there was the COVID-19 thing, the power of attorney, and then paragraph 53, 18:20, the same day, Sunday, 12th of April, I got a call from a nurse who called to tell me my father had another fall in the hospital, and this time he'd landed flat on his face. He now had cuts on his forehead and the side of his head requiring stitching, and she told me he was in a very poor state. She said they were trying to control his movements but couldn't restrain him or dose him with whatever they use. She then went on to tell me my father had tested positive for COVID-19. I was horrified and distressed, to say it mildly.
So that's fall number 4 in your statement.
Yes.
And you're told during a phone call about a fall, his 4th fall.
Yes.
That he's got COVID.
Yes.
And you indicate you were horrified and distressed.
Oh, I was, yes.
Was there any talk, well, did they make inquiries as to the place that he had come from in terms of COVID? Did they ask?
It was all very vague. You know, I mean, I think the next stage you've got to go to is, you know, my father fell again. But the thing, I just felt there was a lack of control. Mm-hmm. I mean, having worked in the oil industry and done courses, I just felt myself that there was something amiss.
At paragraph 54, you indicate that you told the hospital they needed to tell the care home.
Yes. I explained that my father shared a room in the care home with my mother, who also had dementia, and they needed to tell the home immediately. They already had cases of COVID in the care home. I was extremely worried, expressed this. I was also worried about another serious head injury, a fall in their care, and the fact that my dad was COVID-19 positive.
Paragraph 55, you talk about your dad being moved to Ward 111.
Yeah, well...
And you talk about that ward having a nickname.
Well, yes, my dad was moved to Ward 111 at Aberdeen Royal Infirmary, and a person told me, oh, that's not good, because Ward 111 was a Cheerio door, it was referred to, and that was not a good ward to be in. I got really stressed out, because I'd heard that somebody goes in there and might not come out, and I was very, very anxious.
So the next day again,
yes.
We're now on to the 13th of April, you get another phone call.
Yes.
From the hospital telling you what?
Monday, 13th of April, I got a phone call from a nurse at Aberdeen Royal Infirmary. She told me my father had another fall in hospital.
5. 5th fall.
Yes. And this time he'd torn the skin in his elbows, which would probably require stitching, and he'd skinned his knees. I was horrified again.
Did you have COVID symptoms at that stage?
Well, I don't really know. But I mean, the reason that I was told that he, as I transpired, that the reason that I was told he didn't qualify for a COVID test was he didn't have the symptoms that were likely to be seen in a person with COVID at that time of the event.
Could you read the first sentence in paragraph 58?
They told me they were still intending to discharge my dad.
Okay. Tell me about the word still. When had that been raised as a possibility?
On discussion with the hospital, I was told abruptly that my father would be being discharged to where he lived. And where he lived was the care home. And that was that.
I know that you have, from reading the statement, I know that you have concerns about the timing of a potential discharge and a discharge from hospital with the conditions, including the injuries that he had suffered. But as a matter of principle, was it right that if your father had been fit to be returned or to be released from the hospital, the care home had become his home?
Yes, if my father had been in a fit condition to be discharged, the care home would have been his home, but the complication, as transpires, was that my father also had a live COVID test.
Yeah, no, I applied caveats to take those things out.
Yeah.
What's your reaction when you're told he's still going to be discharged?
I couldn't believe it. I don't know how far along I can go the line here, but I couldn't believe that my father, and I mean, I was told, and I think further down, when my father was discharged, I think section 61, I'm looking at it here, that my father was going to be discharged in such a dreadful state with multiple head wounds, bandages, dressings, and I told the nurse I'd spoken to in ARI, and my father was now, and I was told by the staff in the hospital, he was mentally damaged, he was doubly incontinent, which he wasn't before he went into hospital. He had no memory, he was struggling to remember his name, and he was incoherent. You couldn't speak to him. And they still intended putting him back to the care home.
Now from paragraph 60 to 63, you describe a series of phone calls between yourself, Aberdeen Royal Infirmary, and Care Home 2, in which you were basically saying to those organisations, don't release my dad.
Yes, I pleaded with him. I pleaded with him not to do it. I just thought it was insane. I mean, I was worried not only about my dad, but my mother. And the assumption was that they would put my father back in with my mother on the assumption that, well, the care home manager actually said to me, your mother's probably got COVID anyway.
Can you read paragraph 64 for us, please?
The hospital basically put me in my place. They told me I had no authority and that they would do what they wanted to do. The consequences they were accepting. The care home manager told me the same. The consequences of whatever happened would be because the hospital were discharging him. The hospital said it was the government instruction. The care home said it was the hospital instruction. A doctor told me the care home could have refused to take my father back in his condition.
But they didn't.
No.
But the proposed discharge on that day came to be cancelled, is that correct?
Yes.
Was that for medical reasons or reasons at the care home, or was it simple logistics?
Logistics. I was told that there was a transport issue, there was medication issues, so they would do it probably the next day.
And what was the position in terms of your dad going back, given that, and we shouldn't forget her at all, given that your mum is still in the care home, and effectively they were in a double room before he went to hospital?
Well, I don't think that was considered. I mean, my feeling was that if my mother, and I mean, I have provided photographs to the inquiry, and they're not allowed to be shown, but if they were shown in that screen now, and you see my father came out of that hospital looking like he'd been in a serious road accident. And I think the effect it would have had on my mother with her dementia would have been catastrophic. But they didn't accept that. They were hell-bent in getting my father out of hospital, into the care home, and at that point, there was no intention of isolating my father from anybody else.
So that, I don't want to put words in your mouth, apart from the fact that I'm going to.
Yes.
Were the hospital attempting to deal with the person in front of them and not look at his overall situation?
Yes, I just think it was a massive failure in a duty of care. I mean, I actually asked if there had been, I mean, I grew up in an industry where risk assessment was the way you operated, because, you know, risks have consequences. I couldn't believe.
What was your job? What was your job?
I was a control room operator offshore, a process technician offshore, and for about 3 years I authored safety manuals and things like that for BP, platform manuals.
Platform manuals?
Yes.
So, although you don't know anything in particular about hospitals, you know about safety structures.
No, but I was used to being in an environment where everything was risk assessed, double checked, because there was serious consequences if there was mistakes. And I'm looking at a situation where my father has been seriously damaged in the care of Aberdeen Royal Infirmary in a 3-day stay. In fact, 2 days did the worst damage to him. And not only did he have COVID, he was physically destroyed. And they were going to present this situation to my mother, and the consequences would have been, as I've said, disastrous.
When he went back to the care home, because obviously the decision was taken and taken out of your hands, when the decision was taken, do you know which room he went to in the care home, or were you told about that?
Well, I think the bit that was got to go before this was I had to force the hand of the new care home manager to isolate my father. Right up until the last minute, there was no intention of isolating my father. He was going in with my mother. I said, before you do that, I want an email or a text accepting responsibility for any of the consequences of this action.
Were you provided with any reason for them proceeding in that way?
No.
No.
No. My father was put upstairs after that. He was in a, I think it's the same, probably the same area where my mother landed up when she died. It was a smaller room upstairs in the building, and that's where he spent the last few days of his life.
Okay. You talk at paragraph 74 about what you describe as a weird picture.
Yes.
Tell me about that.
When my father, leading up to this, I was out for a walk when I came back, and my wife says to me, "You're not going to believe this, your father's on his way from the hospital on that date." It's on my statement. When I phoned the care home to tell them at about 9:10 that my father was on his way, they didn't know. They didn't know that. They didn't know that my dad was on his way. And that was when I had to push for my dad to be isolated, protected from my mother until at least we found out what the situation was going to be.
Do you know if the care home was aware of the aborted attempt to move him the previous day?
I believe so, yes.
So they were told about that one?
Yes, I think I spoke to them about that as well. I was in conversation with quite a lot of people at that time, yeah.
Yes, I can see that from your statement.
Yeah.
You weren't slow in coming forward.
Oh no, I mean the thing is, they're playing with people's lives, and I just thought this is, this is just. It was just crazy, what was going on. Going back to the picture, the weird picture, yes. I don't know if anybody else here, but probably most people have got iPhones, but on the loop on the iPhone, my dad was taken into the care home. I got a picture sent to me by the care home manager of my dad with bandages, cuts, blood, a nearly closed eye, a swelling on the side of his head. Now, I found out he didn't get scanned for his head injuries he got in Aberdeen Royal Infirmary. He got scanned with a head injury when he fell onto the back of his head. But the more serious falls, in my opinion, and I think the evidence shows it on the pictures, he didn't get a brain scan for the injuries he received in Aberdeen Royal Infirmary. He was sent back to the care home, as I say, and the photographs show it, in a terrible state. The photograph I'm referring to was horrendous, because on the loop that you can hear him being asked to smile. And he puts this inane grin on, and I thought, oh my God. And when I blew it up and I saw the state of him, I was just horrified.
On Sunday the 19th of April, at paragraph 76,
yes,
you get a phone call saying your dad is failing.
Yes.
Where had he been found?
Well, on his notes that I got from the care home as well, this backs this up. I got a phone call from the care home to say that my dad was failing. He was agitated, he'd been shouting for help, he'd been wandering into other rooms, so he was still mobile. They'd found him on his hands and knees trying to get to the toilet. I was then told they were going to introduce end-of-life medication, which would be midazolam and, if needed, and morphine, and I was shocked.
But you were told you could come and see your dad.
I then got an opportunity, because at that date, my father died on the 26th of April, and the impression that I got is that something serious had happened, and he was now in a comatose state, and he might only have a couple of days to go. And I was told I could go in, fully PPE'd, and see my father, but I would only be allowed to stand at the door. Now, I don't understand this, because I don't know if he was COVID negative by then, or maybe they're worried about me going in or the staff, but all I'd be allowed to do is look at my dad lying on his side in his bed. That was all I was led to believe I was able to do.
Give me 1 second. Now or in 10 minutes? We'll do it now. Okay, yep. You'll find out about that in a minute.
Okay.
Do you go in to see him?
No, I didn't go in to see him. My wife, who's here just now, she pleaded with me not to go. My immunity was low because I'd had a spell of illness, which I've described, and I'd been on a fairly lengthy course of antibiotics. I've got a young family, etc., and I spoke to the lead nurse, who I've got great respect for. She was in the care home. I could rely on information from her, and I said, oh, what do I do? And I can't name her. But she said, it's up to you, but what you'll actually see will be distressing, and the fact that you can't touch him, and you are putting yourself at risk, because there's COVID in this care home. And my wife pleaded with me not to go in, because she said, well, you're only going to see your dad momentarily, and you're putting yourself and maybe other people at risk.
That's Sunday the 19th of April.
Yeah.
We're talking about. Mm-hmm. We'll pick it up on Monday the 20th of April in 15 minutes, because the stenographers need a break. That's what I was being told.
The stenographers?
Yeah.
Okay.
Type this up. So we'll come back in 15 minutes.
Can I go back to you?
Yeah.
Okay, thank you.
It's too long. Good afternoon, Just, my lord.
Good afternoon. Yes.
We will pick up simply where we left off, which was at paragraph 79. You talked there about what you describe as a Cheerio call. Tell me about that.
Yeah, well, at 1400 hours, Monday, 20th of April, I had a Cheerio call. I called it on Skype with my dad. That had been arranged via a stand-in manager who'd appeared from another care home.
We'll come back to the fact that a stand-in manager was being used, but we'll just continue on 79.
Yeah. A staff member told me, well, that's okay, right. I took some photos on my phone of my father as he looked absolutely dreadful, and I knew I would need them. I was horrified when I saw the state of my father. He was badly injured, extremely dried up. His head was disfigured on one side.
We can read what's at paragraph 80 and on about the situation with your dad, but it wasn't what you expected.
No. Do I read the paragraphs?
No, you don't need to.
But
just
it might be
tell us.
easier, but what I had in my mind when my father, I imagined he was sleeping away, lying comfortable, tucked in, and he was going to die. But then when I saw him, I was extremely distressed. One of the pictures that I got, it was my father was wearing, in the state he was in, was wearing a large pair of ladies' mitts. Now this picture was sent to me, and I was horrified. I says, why is my father wearing, and I mean huge sheepskin mitts? And she said, oh, well, he was complaining his hands were cold. And my father, as I found out, already stated, had been crawling around on all fours, trying to get to the toilet, had been walking into other rooms, although he was supposed to be in isolation. I found out he'd been crying and shouting for someone to help him. And the other thing that I brought up here was, right from the start, when my father was taken back in to the care home, he had no glasses. And my father had poor eyesight, particularly laterally. My eyesight's not brilliant, but it's better than his. So my father would have been technically blind because he needed glasses to see, and even to see people. Even his close vision wasn't very good. And in all the photographs from the time he arrived back, he never had glasses. And I had mentioned this. I says, what's happened to my father's glasses?
You weren't the only person who had communication with your father that day.
No, my wife was with me.
Was there another Skype call made?
Yes, there was another Skype made. What happened was I was called first, and I'd arranged for my sister to do the same with the same stand-in manager. Yes.
And I understand that you then got a phone call from your sister.
Yeah, but further down, yeah.
Yeah. And what was she saying to you?
Well, we can maybe move up. I can refresh my mind.
85 I'm looking at, yeah.
My sister phoned and said we should get Mum up to see Dad, and I agreed, despite we both had reservations of the effect it would have on my mother. So we asked the staff to take her up to let her see Dad and let her know he would be back with her as soon as he was fit to come back. We wanted her to see my dad because at that point in time we were told he was at death's door, he was not going to survive. And that was stated around the time of the Skype call. There's a point in this as well that I don't know if that comes up later, that we made an agreement when my father first came back. My mother had been looking for my father, for days when he was in hospital. She'd been looking for him and wondering where he was. And when they said they were taking him back, despite my horror, I discussed it with my sister, and I said, well, but what I believe, he's in such a mess that my mother will react badly to seeing him. Top of that, you weren't able to speak, doubly incontinent, you looked totally different, covered in wounds. So we asked the care home to say that my father was, for nearly 5-6 days, was still in hospital, so that she wouldn't, and he was being looked after in hospital. And at that point in time, we had a hope that he might recover and that they could both be back together again, which never happened.
At paragraph 86,
Yep.
surprisingly, you talk about another fall.
Yeah, Tuesday, 21st of April, I got a phone call again from the care home to tell me my dad had fallen out of bed again. He was very restless and agitated, and he was to be given morphine. I was shocked to find out he was not on a related path of injecting to stop his issues. And this is where the confusion comes in, because when you hear that somebody's on end-of-life care, you imagine, as I said earlier, that somebody is, at peace. They're in pain, they can be in peace. And the medication he was given, midazolam and morphine, would be helping him. Subsequently from that, I found out that midazolam isn't a particularly nice drug, and some practitioners refer it to being waterboarded because it floods the lungs. And I don't know if it's been removed, but I believe there's motions afoot to look in at the use of midazolam and morphine in end-of-life care.
Were you ever advised about a specific care plan in terms of end-of-life care for your father?
In the first care home he was in,
No, I'm talking about at the point.
at that point,
Yeah.
No.
Did you know what the care plan was to be?
I didn't know. I didn't know exactly what was going on, and subsequently there was a conversation with a doctor.
And tell me about what was said in that conversation.
I'd expressed my concerns to the returning new care home manager that I was distressed and upset about what I'd seen, what was happening, and the way the end-of-life care was being administered. I was confused because, there was a DNR put in place from the first care home. However, I think anybody here would think to themselves that when they start introducing end-of-life care, that there's no way back and that the person is beyond hope. And yet I found out that my father had been mobile. He'd been walking about. Poor man had been trying to get to the toilet. He'd been shouting for help. And they had started, in my opinion, it was almost like a random decision to keep him quiet, keep him in isolation, in a room, in a comatose state, basically.
At this stage, was there any talk about your dad going back into your mum's room?
There was 2 attempts to get my father put back in with my mother, which I declined. I said, you'll finish my mother off. What I've seen, if you put my father and my mother will go, she'll just go crazy. It'll finish her off. Yeah.
You've spoken about morphine and the other drugs that he was on. I understand that you then got a phone call from the GP practice.
Yes.
Tell me about that conversation.
It was a difficult conversation because out of the blue I got a phone call from the doctor, and it was in relation to my criticism of the use of the drugs. And he said, I'm told you want your father put onto a morphine pump, which I think is a syringe device. And I lost the plot, I must admit. My wife was in the conversation, and I said, so you're phoning me on whose authority? I says, who gave you my phone number? Oh, the care home manager. He said, you wanted to speak to me. I says, I don't want to speak to you. Have you seen my father? The conversation got quite heated. I said, because the way you're talking to me now, if you're asking, I want my father put on a fast-track way, I actually I don't use the word that I'm going to use, but ending his life. And I said, and that is unbearable. I'm relying on professionals, whoever ordered up the end-of-life medication, and how it's being applied is the responsibility of the medical people that are doing it. And I took offence to the phone call. He apologised for phoning me, and I've actually got a copy of his comments on the notes that I eventually got after 3 years. That is a slightly different version of events, but I would agree with a certain amount of it. I then got a phone call from the new care home manager apologising for giving out my phone number and also for the nature of the call. So we had words as well.
You spoke about the new care home manager, the one who was inexperienced.
Yes.
You spoke about him going off sick. Do you know why he was off sick?
I was told he was off with COVID, and it was a
It is.
Trying
There's
my
a
best.
lesson to be learned by us. Good afternoon again, sir. We're ready to proceed. You were talking about telephone calls with the new care home manager.
Yes.
Can you pick that up? Do you remember what you were saying?
Yes, I had phoned the upper floor in the care home, and I wanted to speak to the care home manager. I was put back down to the office to be told that the said care home manager had been ill and he'd left to go home. I said, who's standing in for him? And there was confusion there, because there wasn't an assistant manager as far as I'm aware, although a senior nurse was shoehorned into that position at some point in time. I didn't know who to speak to.
And so far as you're aware, had that care home manager been off for a fortnight?
I believe he was off for about 5 or 6 days with COVID and back into the care home again.
And did you raise that as a problem in
Yes.
terms of self-isolating?
Yes.
And what were you told?
The area manager, who incidentally resigned when the care home manager didn't know, but his area manager later on in this basically walked off the job, and he didn't know that he no longer had an area manager. So I'd had conversations with the area manager. In the event that I couldn't get a hold of the care home manager, I had to phone the area manager. And I brought this to her attention. I said, well, it's on my notes, section 90. I received a call from the care home managers, and he said he had COVID but would be back to work. So I believe he was off from Friday to Wednesday. I complained to the area manager that the care home manager was back at work, and I got a reply saying that they were following Public Health Scotland guidelines for staff. I sent her a media link of a carer who had been suspended for not complying with the length of time that they should be off before they return to work. And I retained the link, but I never got a response.
No response at all?
They just said that they were complying with the Public Health Scotland guidelines for staff.
On the 26th of April 2020, at about 8 o'clock, you received a telephone call from a member of staff at the care home. What did they tell you?
Have you got a section for that for me?
I'm looking at 98.
Yes. The area manager, who I'd had conversations with, she called me at 8 o'clock in the morning of Sunday, 26th of April, to tell me that my father had passed away in the home at around 1 o'clock in the morning.
And can you read the final part?
And he'd been pronounced dead by a GP at 4 o'clock in the morning.
And this phone call took place at 8 in the morning? This took place at 8 in the morning?
Yes, I got a phone
7
call.
hours after your father died?
Yes.
You then got mixed messages from the new care home manager.
Yes.
And you explained that over a few paragraphs, but I think you can probably...
It's a very disturbing phone call, because the care home manager subsequently told me that my father had passed away quietly and peacefully, and he'd been with him at the end. I says, but you weren't there unless you were called out, because my father died at 1 o'clock in the morning. So I confronted him about this on the phone. And I said, you couldn't have been there, because my dad, as far as I read his notes, he died between midnight and 12:30. He'd last been seen on his notes at 12 o'clock. They said he died at 1 o'clock and he was pronounced dead at 4 o'clock. I got told at 8 o'clock And the care home manager told me that he said he'd been with him because he thought it would make me feel better. And I said, well, it's actually made me feel a lot worse because it was a lie, and it was a significant lie. It undermined a lot of things. I mean, what I've got here is, how can you possibly say to somebody, you were sitting with our dad and they passed away peacefully when you weren't even there?
You kept your own meticulous records
Yes.
of what had gone on.
Yes.
Why did you do that?
I knew from the start, I knew from my father's injuries and what was going on with COVID that it was going to be a disaster. And I'm being honest, I thought, whenever I spoke to the hospital, my own training kicked in. I thought, I've got to maintain a meticulous trail of what's going on here. It was almost like a premonition. When I saw what was happening in the hospital, Aberdeen Royal Infirmary, I'm glad I did, because I wouldn't be able to remember most of this.
The next part of your statement relates to to complaints that you made to a number of bodies.
Yes.
One of which was Aberdeen Royal Infirmary, and you refer to that in paragraph 105.
Yes.
And you refer to a meeting with one of the doctors, a consultant.
Yes.
Can you summarise what it was the doctor said to you?
Well, I think the paragraph before, I put in a formal complaint regards my father's treatment and discharge with injuries in ARI to NHS Grampian on the 29th of June 2020. I declined accepting an initial letter of response that I received on the 31st of August 2020. We then were allowed to have a meeting with ARI staff, and that included the head of infectious diseases, the consultant at Aberdeen Royal Infirmary. And my wife was with me, and he led us to believe, or more or less said, that they were acting on government instructions.
Now, hang on, can I interrupt you there?
Yes.
Because you said two different things about that.
Did I?
Led us to believe and told us.
Well, told us. Yes.
Told you.
Yes.
Right.
He said that there was a policy of discharging patients back into care homes to clear out the hospitals.
And that was the head of infections,
Yes.
Aberdeen Royal Infirmary,
Yes.
a doctor that you name
Yes.
in your statement.
Yes. And the public weren't aware of this. And I asked them directly, because, I mean, you got a rambling conversation, and my words were, as far as I can remember, and my wife will probably back me up, I said, you're head of infectious diseases in Aberdeen Royal Infirmary, and do you think the decision you made, sending my father with live COVID into a care home, was the correct decision? And he said, in hindsight, no.
You then get a letter from NHS Grampian,
Yes.
and you quote from that letter.
Yeah.
Can you just read the part that you quote?
Quote from revised NHS Grampian letter of response dated the 24th September 2020. We agree that the rapid discharge of your father was not the best decision and clearly caused your family considerable distress. I hope you can accept our apology. There was no mention in the letter about the live COVID discharge to the care home. And ARI were fully aware of the care home arrangements. I discussed this in the period leading up to my father being discharged. I told numerous people.
Because if you read that quotation, that could be an individual being returned quickly to a house on their own. You just read those words.
No, I don't think that my situation was considered. I got the feeling that the fact that, and I told the staff in the hospital that my father shared a room with my mother, and the assumption that was accepted was that my mother was likely to have COVID-19. So if you read into that, what I read in, the risk was minimal. So I did ask at that point in time, was a risk assessment done by the hospital? And maybe I'm fast-tracking into this.
No, it's okay.
But it transpired that no documents existed. The care home manager told me that he had no discussions with the consultants at the hospital or direct conversations with a doctor on the method of looking after my father and the distressed mess he was being returned back in. And I asked for these documents, and they don't seem to exist.
Okay, I want to ask you about 3 sets of records, okay? ARI, Aberdeen, the care home, and the GP practice.
Yeah.
Did you get the records from ARI?
Yes. It took over a year. I found obstruction every single path that I took, and the worst was the GP practice.
That's the next one I'm going to ask you about.
Yes.
Again, have you now recovered? Yes. And when did you get them?
About a month ago.
Right. And had you been involved since your father's death in trying to recover them?
Yes.
When did you begin that process?
Probably, I don't know, a year and a half ago, 2 years ago. I don't know.
A year and a half to 2 years.
I could find that. Certainly, from an early stage, I tried to get all the medical records. And as time goes by, you know, you start to, it wears you out. I mean, I nearly gave up a couple of times, but I couldn't give up. I just kept on going. And a point I note down here I would say is, NHS Grampian were extremely obstructive for me to get notes. I had to provide loads of evidence of who I was. My power of attorney died along with my father, as they reminded me, so I couldn't, even though they knew who I was, I couldn't use that lever. The worst case of all was with the GP practice, because most members of the public don't know what's going on with GP practices. And part of the reason that they're in decline is because they can't be managed properly. And what I found out was, and the reason I managed to get GP records was because an English company, which I can't name, I found out had taken over the said practice.
And that English company facilitated the release of the GP records?
It was night and day. I got in touch with them, I wrote an email, and I just said, I believe, now I did this on a Google search, they've taken over 2 GP practices in Aberdeen, and one of them is the one that I needed to get access to. Their safety manager was fantastic, and I've thanked her profusely. When I told her the situation, you leave it with me, and she got it done in a matter of weeks.
So we've got ARI, GP practice,
yes.
Care home records.
Yes.
Did you recover those?
Yes, I got the care home records fairly early on.
And was that a difficult process compared to the GP?
I don't recall it was particularly difficult, but it was there were, how do you put it, things on there that didn't refer to my father that I reported to their operations director, because I'd given up dealing with the care home manager. His area manager had walked off the job. She just apparently resigned on the spot, so I'd lost that contact. So I started dealing then with the operations director. And for instance, on my letter of complaint, which I was 2 letters went to the operations director of the company involved, and they said in the notes that my father, numerous times, my father needed help with his dentures. Now, my father was 88, and thankfully that's one of the things that I've got his blood pressure problems, but I've got teeth. I've got my own teeth. I've no false teeth, and I'm 69. My father had no false teeth. Very rare in a man at 88. He had a couple of dodgy teeth, but he had no dentures. So I brought this to their notice. I says, well, you know, you've got in his records, no, nearly said his name, that my father needed help with his dentures. My father needed help with his dentures. My dad didn't have dentures.
Let me ask you about that, right? Mm-hmm. That's clearly an erroneous entry in the care home records.
Yes.
what does that do to your impression of the other records the care home have?
Well, it undermines my confidence that they're accurate.
Because it may not, it's one of those things where it doesn't matter when they say he's got a problem with his dentures if he hasn't got dentures. If it was the other way round, that would be a more significant problem. But your concern relates to the accuracy of the records that are being provided to you. Is that correct?
Yes, and when I got the records, I found out incidents that hadn't been directly reported to me. I mean, I was the main point of call. Although I've got a sister, I was the main point of call. I lived locally. I dealt with the sharp side of this. So when I got the records and I read them, that jumped out at me right away. You know, that the fact that the care home manager told me he'd been with my father at the end, and he admitted he wasn't because he thought it would make me feel better. And then I get the records and I see things in there that I was not made aware of, and things like my father needed help with his dentures when my father at 88 didn't have dentures.
Tell me about the death certificate that was issued. Did you have a problem with that?
Yes. I got a phone call about the death certificate, I got a phone call about the death certificate, and in fact I haven't got a copy of it here, but on the first line it was COVID-19, 2019, and his other issues, long-standing health issues, was
that were listed at the beginning.
Yes, with circulation and it's a big word, I can't remember it now, but COVID-19 was top of the list. So when the doctor phoned me, I said, well, you know, I dispute this because the father was sent out from Aberdeen Royal Infirmary with traumatic head injuries. His head was disfigured. He was covered in stitches, and that's not mentioned. I said, you know, he was discharged from Aberdeen Royal Infirmary's care. He went in with a rear head wound, and he came out doubly incontinent, and I went through all that thing. Incoherent, his memory was gone, and he had a horrible death. I said, but all you've got is COVID-19. And the conversation got a bit stressed. And I don't remember the exact wording, but the wording was that if I refused to accept the death certificate, there could be complications. It could delay the situation. Now, bearing in mind...
Well, what situation?
Well, getting my father's cremation. Mm-hmm. And obviously, I mean, it's a strange situation, and I don't know if other people have said this. When my father died, now, I spoke to the undertaker. Now, as far as I'm aware, he was treated as contaminated, even though I don't know if he still had COVID. But he was put in a body bag, or maybe two, with the clothes that he wore. Now, he'd on a polo shirt, I think, as pyjamas latterly, the last photographs I got. So he was taken out of his bed, put in a body bag, put in a trunk, and taken to the mortuary at the restrooms, and put in a sealed coffin. So he was treated as contaminated. So I'm thinking to myself when I was speaking to the doctor, it's highly unlikely now that they could do an autopsy to find out what killed him. And I would have had to tell my family that I had halted proceedings because I decided to dispute the cause of death.
So it wasn't disputed and the funeral proceeded?
Say that again?
It wasn't disputed and the funeral proceeded?
Yes. I had to accept it. In my heart of heart, I needed closure. I think my family needed closure. And the funeral arrangements were equally harrowing.
I'll come back to that in a second, but yep. You say at paragraph 137, the man I dealt with at the Undertakers was excellent.
Yes.
Very sympathetic to our ordeal. He agreed to stop the hearse in front of my car.
Yes.
The funeral directors and workers were under enormous pressure.
Yes.
Now, you had described in some detail in the preceding paragraphs the funeral itself.
Yes.
And you say that they had the hearse stop. You were able to get a photograph of the coffin in the hearse.
Yes.
There were very limited numbers.
Yes.
You were in the car park for the funeral.
Yes.
Was there anything else significant about the funeral that you want to say to me? Us?
Well, when I had to go to the undertakers to hand over paperwork, and you've got the cremation certificates and all that to do, I was advised, it seems crazy now, the police were stopping cars on the outskirts of Ellen in case anybody was going outside Aberdeen City. And I lived in the Shire. I was living north of Aberdeen at that time. And I was advised to carry paperwork in case I got stopped by the police in my car. Mm-hmm. Now, I could travel from Ellen to Ballater, which was within Aberdeenshire, which was about 60 miles in one direction. But to travel 12 miles to the city limit, I could be seen as breaking COVID. That was how crazy it was. So I had to carry, you know, the funeral paperwork in with me in the car to go there. Now, the reason that I'm saying that the chap at the funeral parlour was good was because when I went to see him, and they were under enormous pressure. When I was there was a woman near hysterical in the office, you know, so it was very uncomfortable. And he said to me, you know, what I could do is I could approach the hearse, they would open the tailgate, and I could touch my father's coffin. Now, you're still thinking that this is COVID live, but I was told it had been desanitised. But I had to wear full PPE, and I had to put it on in front of the people in the car park. The only way I could touch my father's coffin was by doing that. And I didn't think I had it in me to do it. I was emotionally wrecked at this point in time.
Did you do it?
That was, you know, so what actually happened was, the other thing that other COVID bereaved have had to deal with was, I was allowed, it was either 16 or 18, I can't remember, we'll say it was 18 people at the funeral. We were allowed, I think it was, again, 6 or 8 cars. The cars had to be in the East Chapel car park at Aberdeen Crematorium. We had to leave 3 spaces between each car. We could only congregate in our little group, which was my wife and I in front of my car, my son and his wife in another car, my sister and her husband in another car, and I had to tell family members they could not go to, my father's funeral, and that was difficult. Yeah. So you've got to then compile a list of those that can go and those that won't go, and couldn't go. So on the day, and we're lucky, it was a nice day, the hearse did exactly what the chap said he would do. He took a note of my number plate in the car, and he pulled the hearse up opposite me. He says, I won't be allowed to linger. We've only got like 10 minutes. So that you imagine a hearse arriving. We were told we could have flowers in the car, but they would be a waste because they would be destroyed immediately. So you'd only see them momentarily. And he advised against it. He said, so the hearse arrived with a blank coffin in the back, pulled out opposite me, and my sister and I were allowed to go up to the hearse but not touch it. And I took a photograph of my dad's coffin. The hearse drove away, and they said, we won't be going to the chapel side, we'll be driving to what is classed as industrial side. Mm-hmm. So, you know, it wasn't as if you could even walk down to the front. It went away around to what you class as the tradesman's entrance, where my father landed up.
Okay, you talk next in your statement at 139 about personal protective equipment.
Yes.
Again, just reading, having read that over, this was a difficulty in the care home accessing PPE.
Yes.
And your son, because he works in the oil industry, being able to access it.
Yes.
You were given information about the quality of the PPE that your son was able to access.
Yes. Well, what you were seeing on the TV at that time, and particularly one of the managers of the company that had the care home, was that there was a lack of PPE and the quality of PPE was variable. And I knew, speaking to the care home staff, that they were struggling for PPE. And I discussed it with my son. And my son made 2 phone calls. And he got top quality PPE delivered free of charge. My sister did the same and got a friend to deliver PPE. And my neighbour at that time had a family linked to a business that did medical supplies. And he said, I'll get them top quality stuff. They had a shipment coming in from America. Now, what arrived was, it was so good that the care home manager and staff posed outside with some of the stuff. You know, they got memory foam visors, high quality material that they were never given. And I think my view is it comes down to cost. It's availability and cost, and that's one of the things I say later on. There needs to be a standardisation, and these people are at high risk, and they were at high risk. And later on I said that. I really felt for the staff working in that care home, because they were dealing with people, you know, that some of them had been in the care home for years, dying.
I want to ask you next about something that must not be forgotten, and that's your mother.
Yes.
Because we've spent a long time talking about your father.
Yes.
Your father has now died, and your mum is still in the care home.
Yes.
Tell me about the visits.
The visits? Well, I think the first thing that needs to be said is when my father died, I got a phone call from, again, a very reliable nurse that we had a good rapport with, to say, we need to tell your mum that your father has passed away. Now, bearing in mind, my mother got Alzheimer's. Would you like to do it? Well, obviously, yes, I'll need to tell my mother. So I had to gear myself up, and I think it was on the same day that my dad died, or I think it was the same day, I don't remember. But so they got my mother to a phone, a loudspeaker phone, and I told my mother 2 or 3 times that my father had passed away, the nicest way of saying it. And where's he gone? Where's he, you know, I think she thought passed away meant he'd went someplace else. And I said, Mum, Dad is dead. He's died. And she went hysterical. She dropped the phone, and I was extremely upset. And the nurse came on the phone, and she was upset. She said, "Okay, Bill, we'll deal with your mother." So
tell me about subsequent visits.
Subsequent visits were the same. When we did get to see my mother, it was on I think it was 2 meters at the time. We were allowed to see my mother outside in the garden, and she's got a shawl around her because she was quite frail. She was feeling it cold. I could see a massive deterioration in my mother. She was now alone. And by the way, when I told my mother my father had died, she went back to looking for him again. She went back hunting around the premises and asking staff, "Where's my Bill?" It was me. And it just became unbearable. That's all I can say. The visits with my mother were equally unbearable because she couldn't understand why we couldn't be with her, we couldn't hug her, we couldn't go in for a cup of tea. And my last time I think I saw my mother in the care home, she was waving out a window at the car park because it was really cold. And I must admit, the staff that were doing that, again, were fantastic. And we had one member of staff in there who was actually like the events coordinator, who was a lovely person. And I actually asked for her to be with my mother because my mother and her got on so well, and she felt our pain. And I think that was something that was missing. You know, the empathy with a lot of people wasn't there. But with some people, and you get to know that when you're dealing with care homes, you know natural caring people. You know people are there for a job, and you know people that are there because they enjoy what they're doing, you know. And I think the last view I had of my mother was in the care home, was waving out the window of the dining room when my wife and I left in the car.
And as I understand it, she suffered a stroke.
My mother suffered a stroke, and she landed up initially in Aberdeen Royal Infirmary, and I went to see her there every day until she got moved to the stroke unit at Woodend Hospital in Aberdeen. And that was equally traumatic because I wasn't allowed to touch her. And by then, she was virtually unrecognisable, and withering away, and it was unbelievable. And I went in on a weekend, and one of the nurses I'd been speaking to before, who was so distressed. I'm sitting in a room about half the size of this, and my mother would be where you are, and lying to one side, and wearing somebody else's clothes, by the way. That was another thing that I don't think has been brought up. That my mother was presented to me in a wheelchair, and I was told by the nurse or auxiliary, look at the state of your mother. She's wearing somebody else's clothes. And what do you mean? She says, well, we don't know where her clothes have gone. And I says, well, she came in with clothes. So I then found out that Wood End Hospital were not doing laundry because of COVID. They asked me to take it home, which I refused to do. They weren't doing laundry because of COVID. They were sending it to Aberdeen Royal Infirmary. I then found out that Aberdeen Royal Infirmary weren't doing COVID washing either, and they were sending it in by the truckload to Glasgow. And the reason I'm saying that is I've got the combination of my mother in distress and with a stroke and wearing very odd clothing. I got to touch my mother. It probably hadn't been the legal process, but this nurse was so upset. She said, look, I'm wearing PPE. Put extra gel on your surgical gloves and hold your mother's hand. So I leaned over, and my mother wouldn't let me go. She broke into tears, and I felt physically sick, and it stays with me now. She wouldn't let me go. And I discussed my dad with her. You know?
From paragraph 150 to 159, you detail the complaints that you've lodged. I've taken you through each of those. I don't think we need to go through those any further.
Well, you want me to read from 150?
No, I'm just saying, I've taken you through all of that.
Yes.
There's no need for this to go into oral evidence. I'm not trying to hide it. It'll be there, and Lord Brailsford will read it.
Yes.
And that also applies to some extent in relation to impacts, because I've very carefully taken you through the impacts.
Yeah.
But I do want to ask you a little bit about lessons learned. Again, that's something that the inquiry will read and will consider carefully.
Yeah.
But can I take you to paragraph 173, which is in hopes for the inquiry? Because I think that's the only bit of your account that we haven't covered. And it's something you want to say.
173.
Yes.
My family and many others, including the COVID bereaved, believe the Scottish COVID inquiry has been compromised by repeated media reports of the Scottish Government, the Scottish National Party and others allegedly deleting, withholding and altering evidence needed for the inquiry. I reported this to Lord Brailsford. The thematic approach in Scotland means those accountable are not questioned until next year, and I had asked for a statement regards this. And the reason, even 2 days ago, I met a neighbour, and he knows that I'm coming down here. And he's older than me, he's probably nearer 80, 85. And he said, you're wasting your time. You know, and this is, I think, the general public, and I'm speaking on behalf of my family, friends, people I speak to, cannot believe that there can be constant reporting of the government deleting, altering, and possibly withholding evidence that will never be recovered. And I can keep a meticulous record. And yet I'm not employed to keep this meticulous record. There are those in position of power, from the First Minister, former First Minister, the whole lot of them, that should be held to account sooner rather than later.
You've said that to Lord Brailsford.
I did, yes.
You've said it again today.
Yes.
I don't have any other questions for you. Is there anything else that's important that we haven't spoken about? I've tried to cover everything fairly.
I think the one thing that I would say is that I think the care profession, the care home profession are neglected. And what I've witnessed, there needs to be a standardisation of PPE. They need to step up, and instead of buying the cheapest alternative and having low stocks, there needs to be a quality assurance situation like we did offshore. We had separate gloves for separate jobs, separate tools for different jobs. And I think what I saw, I mean, the apron I got in the care home was like cling film. And I actually said, how on earth can you, if you tied it around your back, it fell apart. She told me, she says, we're being asked to wipe them down because we haven't got enough of them. And I couldn't believe it. And it's the same with the masks. We all know now we're walking around with that blue paper masks, and they were totally and utterly useless. They lasted about 5 minutes, if that. And so I just feel that's one of the things. And I think I've said enough.
I think you have. I think we understand your position.
Yeah, I feel upset about that,
Yeah. Okay, thank you very much, Mr. Jolly.
Thank you.
Lord.
Thank you, Mr. Jolly. Yep.
Thank you.
Do you want a brief break, my Lord?
Yes, I'd like to speak to Mr. Gale and you now, please.
Yep.
So we'll have a...
We'll go to the appropriate room.
And you go to the appropriate room, please. In fact, wait 1 second, Mr. Cascade. Yeah, I think just go to the appropriate room, please. Could you tell the audience that someone will make an announcement about what we're going to do in the next 10 minutes?
You've heard that. Thank you, my Lord.
Announcements made.
Good afternoon, my lord.
Good afternoon, Mr. Gill.
The next witness is Dr. Alan Wightman. His wife is sitting next to him at the witness table, and Dr. Wightman will be with us in a short time. His statement, the reference is SCIWT 0524, and then 501. Good afternoon, Dr. Wightman.
Good afternoon.
Can you give us your full name, please?
Yes, it's Alan Wightman.
Yes. Now, your personal and contact details are known to the inquiry.
Right.
You've provided the inquiry with a statement. I've given the reference to that statement. Your background is that you are a retired development scientist.
Yes.
Could you just give us a little explanation of what that entails?
Yes. When I left school, I went to Heriot-Watt University and did a degree in chemistry. I then went to University of Lancaster and did a master's degree in polymer science and technology. And I stayed at Lancaster and did a doctorate on the fascinating title of Polymer-Supported Reagents and Catalysts. And there's a showstopper right there.
I'll take your word for it. So, and your work as a development scientist, briefly, could you explain what that entailed?
Yes. Having done the doctorate, I decided the world of academia was not really for me, and I wanted something more immediate. So I went to industry, and I first worked for 3 years for a company that made bituminous roofing felts. I then had a complete change of direction and went to work for a company making food contact papers. And I was there for 22 years.
Right.
And latterly, the final 10 years, I went and joined a weaving firm, weaving polypropylene fabrics for industrial end use.
Okay, thank you. The statement that you've provided the inquiry with can perhaps be divided into two sections. The
Yes.
first deals with the circumstances of the death of your late mother, Helen Wightman.
Yes.
And we know from your statement that your mother died at the Scooney Care Home at Windygates Road, Leven in Fife,
Yes.
on the 6th of May, 2020.
Yes.
And she was 88 when she died, and sadly she was suffering from dementia.
That's correct.
The second part of your statement is that which begins generally from paragraph 77 onwards. It's not necessary to go to that just at this stage. But you begin, first of all, by providing the inquiry with an overview of the concerns and impacts as reported to you by other members of the Scottish COVID Bereaved group. Is that
Yes.
right? And as you tell us at paragraph 2 of your statement, you are a lead member of that group.
Yes.
And do I take it that for the purposes of your evidence today, you are speaking on behalf of the membership of that group?
Yes.
To follow on from that, and perhaps just to set your evidence in context, it's perhaps useful that at this stage we take and begin with your involvement with the group, which you deal with at paragraphs 70 to 76 of your statement, and if that can be shown on the screen in front of you.
Right. You want just to read these?
Yeah, I'll just look at some of this
okay.
in a moment, Doctor. I think the other thing that we perhaps at the outset should acknowledge is that you have also provided a statement to the United Kingdom inquiry.
Yes.
In relation to Module 2 of that inquiry's investigative work. And it's actually termed your impact and inequality statement. It's dated the 20th of September 2023. And the inquiry has considered that statement. It has also considered the oral evidence that you gave to the UKI, which you did on the 4th of October of this year. And for the reference, the transcript reference is to pages 132 to 146 of that day, the 4th of October.
Yes.
Can we go to paragraph 70 of your statement, Doctor?
Yes.
And you begin by referring to an individual, and it's not necessary to name that person, but another person who is another lead member of the Scottish COVID Bereaved group mentioned to you, obviously after your mother's death, that the Procurator Fiscal was investigating COVID care home deaths. And you then contacted the Fiscal.
I did.
And they confirmed that they were not investigating your mother's death. Is that right?
That's correct.
Was that the local Fiscal? Was it Kirkcaldy or was it Dundee?
No, I think I contacted the Edinburgh office.
The Edinburgh office, okay.
The reason my mother's death was not being investigated was there had been a direction that care home deaths due to COVID would be investigated, but only after a certain date. My mother's death preceded that date. But it's subsequently, and unchallenged by me and others, the dates were extended. I have to say, though, that in the 3 years or so since, very little appears to have happened. I do get periodic updates. I think it's might be every 3 months or every 6 months. And the update usually reads, there is no update. And I think this is a common experience amongst other members of our group.
Well, I think the inquiry knows that the Crown Office has carrying out an operation called Operation Coipa.
That's correct.
And that is an ongoing operation considering deaths in care homes during the pandemic. But one of my questions to you was going to be, you've not received any further update as to what is happening with your mother's, the investigation into your mother's death.
I have not, and I have not been contacted by Scottish Police who are carrying out that operation that you spoke of. So as far as I'm concerned, nothing appears to have happened.
Yeah. What, having reported the matter and achieved the extension of the time period during which these matters can be reported, what was it you were hoping to achieve by reporting the matter to the Fiscal?
Well, if the Fiscal had decided that this was a matter that needed to be investigated, then it needed to be investigated in all such cases, was one thing. I have to say, I do not, as I have understood it, and perhaps incorrectly, but what they are looking for is any evidence of criminality or neglect or something like that. And in the case of my mother's care home, I do not believe they will find anything. I think it was a well-run care home, and the staff did the best they could in the very difficult circumstances they were placed in. So it's not that I'm after anything against the care home per se. I'm not. It's just to make sure the investigation is as full as it can be.
Thank you. You tell us at, excuse me, paragraph 71 of your statement that you became aware of the COVID Bereaved Families for Justice group, which was a UK-wide group, as I understand it.
It was, yes.
And that was because of the involvement, I think, of a Dr. Kathy Gardner, and also, I think, also a Miss Faye Harris, because they began a challenge.
They did.
A
yes.
judicial review challenge in relation to certain documents issued by the Secretary of State, the Westminster Secretary of State for Health and Social Care, that certain documents that had been issued in March and April 2020 were unlawful.
That was the case that she brought, and I think ultimately got a partial success with. But it was in reading the article about her and their campaign and her companion's campaign that this group, COVID Bereaved Families for Justice, was mentioned. So I thought, I think I'll make contact with them and see what they're about.
And just again, to set matters in context, the challenge by Dr. Gardner and Miss Harris was in part that those who drafted the documents that were under challenge failed to have regard to the risk to elderly and vulnerable residents from non-symptomatic transmission, because that had previously been mentioned by, amongst others, Sir Patrick Vallance.
Yes.
Yes. And the citation for the record of the case is Gardner and Harris and the Secretary of State for Health and Social Care. The neutral citation is 2022 EWHC 967 admin. I think you're aware that it was partially successful.
Yes.
As you put it.
Yes.
Yeah. Now, you say at paragraph 72 that when you joined the group, you made it your business to try and find out other Scots who were involved or had similar experiences as yours. Can you just explain why you did that and how you did it?
Because my bereavement was in Scotland, and that's primarily what I was interested in. I'm aware of the different jurisdictions, the different governments, different laws, and therefore I thought, whilst it's a United Kingdom group, I'm in Scotland and I should try to find out other Scots who've been similarly affected. And if I saw a post that described a town or a location in Scotland, I would contact that person. Even if, as ridiculous as this may sound, if someone with a Scottish-sounding surname, I would reach out and say, "Are you in Scotland?" And many times the answer would be no. But slowly and over time, I started to contact people who were members of the group who were in Scotland, and I just was starting to collect the stories and looking for similarities and threads, and I called it a Scottish subgroup, but it grew and it kept growing, and ultimately the UK group made it the first regional branch. And at that point, I was appointed chair of that in the meeting that was held by the then campaign manager.
Right. In September 2022, and just check that is 2022, it's in paragraph 73.
September of last year, yes, just the UK inquiry. We got down in October for the formal start of the UK inquiry, and it happened just the month prior. I think it was September. But I'll go with that. It's the nearest
Okay.
I can remember it.
Right.
It was round about the time that the UK inquiry was beginning.
And you say that we became the Scottish COVID Bereaved group,
Yes.
and that was separate, as I understand, from
was.
the COVID Bereaved for Justice
It
group.
became completely autonomous from them, yes.
And what was the purpose of setting up that group?
The separate group,
Yes.
there's a bit of the story we haven't come to yet, but when we were told by the First Minister there was likely to be a Scottish inquiry and that she wanted us to be involved in setting the scope, we realised what a big deal this was, and we needed to get some legal advice. We were bereaved members wandering about in the legal system, not sure, and we had the UK group had a law firm based, I think they're based in Manchester or Liverpool actually. Liverpool they're based. Not specialists in Scots law, so we asked, can we have a Scots lawyer? And they said, oh no, we'll pick someone for you nearer the time. And we said, but now is the time. We might be involved in scoping an inquiry in Scotland. We need legal advice. And they said, well, we can bring Amar Anwar to the table. And we said, thank you very much. So he duly brought Amar, and he became Solicitor for Scotland. But as time went on, and it became evident that the UK group, and you might find some resonance in some of the evidence that's been given in the last few days on this, what I'm about to say. The UK group was predominantly English and was English focused. For example, they were dealing with the Care Quality Commission, which only has jurisdiction in England. It's of no help to people who've got grievances in Scotland. So it became quite evident to us that we would need to think about separating, and we said we want Amar to do not just Scotland, we want him to do the UK inquiry for us as well. And then we were told, well, if that's what you want, you might want to think about going separate. So we said, okay. Mm-hmm. And so it was a mutual, not entirely amicable, but mutual agreement to split the groups.
Oh, okay. How many members were there in the group approximately at that time?
Gosh, now you're testing me.
Just an approximation.
Yeah, I think about the time we met the First Minister, we only numbered something like 30 to 40.
Okay.
Quite a small group, but it's grown. And at that time, it was probably, now let me think. At one point in time, we were challenged to try and get up as high as 160 members. Now, so there's no way. We were 40. How are we going to get to 160? We got there, I would say, by the date that we're speaking about, and today we're north of 200, pushing towards 250, I think.
Does the group have a formal constitution or formal office bearers, anything like that?
No, it doesn't. And what it had was the 5 people that was well, again, I'm getting ahead of the story of what happened when we had the meeting with the First Minister.
Yes, I'll come to that meeting in a moment.
But there were 4 speakers picked jointly by one of the founders of the UK group and myself, and I was asked to chair it. So the 5 of us that went and had the meeting online, and there were other members there was a Zoom meeting at that point in time because you couldn't do face-to-face. And so we had other members of the group were also in the Zoom, but didn't participate until right at the end when a couple of them asked questions. Okay. So those people, when the group founder and the UK advisors and office bearers were partly, they were listening in as well, but they were not participating. But they were delighted that we'd won the possibility, we'd won the support to push for four-nation inquiry, but the backstop of a Scottish inquiry should that fail.
Let's just come to that.
Right.
If we may, you refer to it in paragraphs 74 and 75 of your statement.
Yes.
You indicate that the UK group had asked for a meeting
Yes.
with the then Prime Minister, Boris Johnson, but he refused, as I
I
understand.
think at that point in time he had refused 5 times to meet with them, and by the time the Sturgeon meeting happened, they'd been refused for a 6th time. Now, the request that went from the group to the First Minister was, Boris Johnson won't meet with us, will you? There was no mention of inquiries, there was no specific either Scottish or UK inquiry, but would you meet with us was the simple request. I have a copy of the original letter that was sent to the First Minister's office, and she said yes in February. That was November. Let me back up a little bit again. Before that time, and I can't remember exactly when, but it'll be a matter of public record. Sometime at the end of Wave 1 and going through the summer and into the new season of Parliament, at some point the Scottish Parliament had voted that there should be an inquiry into what happened in Scotland in the care homes in Wave 1. That had passed through Parliament. There was an obligation on the First Minister to do something about it, but she wasn't doing anything about it. Okay. And I was given her, by this time I'd started to do a bit of press in Scotland, and I was going in the papers and saying, you should have this inquiry, you should have this inquiry. This is undemocratic, your Parliament voted for this, you're not doing anything about it. And I was asked by the UK group, will you just tone that down a bit, because we're asking her for a meeting, and if we do get the meeting, we'd want you to be involved. So I did back off, and the meeting subsequently was held.
Yeah. Now, you tell us about 5 of you meeting with the former First Minister remotely in March of 2021.
Well,
what was the purpose of that meeting?
It really was to tell to the First Minister directly the stories of individual loss. And my role was simply to chair and let these people tell their stories, which they duly did and did very well, and it was very impactful. And,
can I ask, just before you go any further, so far as the reaction from the First Minister to hearing those stories, can you tell us what that was in general terms?
She seemed genuinely moved, and at one point was actually seen to wipe away a tear, and it did seem to be very genuine. I'd also been given the brief moments before the meeting began. Now, we've got 4 stories, right? Don't let her respond to each one, because time she does it, we'll run out of time. You tell her she's not to respond to the first story until the second one's also done, and then she can respond to them both. I thought, right, okay. I did, and to be fair, she complied. So 2 stories were told, she gave a reaction, 2 more stories, she gave another reaction, and at the end of the meeting, I'd also, to be fair, I'd pointed out to her in my chairing role at the beginning, of course your Parliament has asked you to have a Scottish inquiry, but we're asking you, would you go and negotiate with Mr Johnson and tell him he should be having a UK inquiry? Right. And she said at the end of the meeting, well, I've got the actual quote.
You quote it, it's paragraph 74.
I will strive for a 4-nation approach, at least in parts, if possible. I will move ahead on a Scotland-only basis if a 4-nation approach is not possible. Now, that was in March, and she said we would have a decision on that before the end of the year.
Yeah. So far as that what was contained within that quote
Yes.
from the First Minister, which the then First Minister, which you record in paragraph 74.
Yes.
Did you get an impression from, I wouldn't say you were in the room, but you were on the Zoom call.
Zoom, yes.
Did you get an impression as to what you thought her reasoning was for going down this route?
At the time, we thought and she did seem to genuinely react to the stories she was being told, and had said she would do this. Now, was it entirely altruistic? Bearing in mind she had this thing hanging over her of, well, your Parliament said you need an inquiry, and you're not doing it. And there's always the trade-off. We're hearing a lot in evidence in London in particular about trade-offs. I don't really care what the motivation was. The thing was she'd made us a promise. And everyone was cock-a-hoop on the night. And we all met virtually again outside of the meeting, and then everyone was absolutely over the moon, including the UK group, of what had been achieved. But when we started to press them to say, you know, we need to move on this, we need support, the response we got was, Scotland's had its turn, we need to focus on other areas now. And that's when we started to realise we were going to have to do this ourselves, and we would need a Scottish solicitor. And that, it took from then 18 months or so before this split actually happened. But you could say that perhaps was the genesis of the split. In my mind, I thought we'd done something great. And they would use that result and use it to drive the Prime Minister to have a UK inquiry. And I believe that ultimately is what happened. I don't think he would have capitulated when he did on a UK inquiry had there not been a Scottish inquiry on offer first. So I think we drove the whole thing forward on a UK basis.
You were informed subsequently by the then First Minister that she wanted the group to be involved in setting the scope
Yes.
for the inquiry.
Yes.
And was that a role that you responded to?
Yes, we did. Not really knowing what that meant was the reason why we said, well, we really need to get a solicitor involved to guide us on this. And that's, as I say, when Anwar came on board as our solicitor.
And in point of fact, did you
Yes, we did.
give an indication of what you felt would be the appropriate scope of the inquiry?
We did. We had a number of meetings. She appointed John Swinney, Deputy First Minister, as the instructing minister for the Scottish inquiry. And we had a number of meetings with Mr. Swinney and his team. Both the five that had become the lead team at that point, the four speakers plus myself. We had those meetings, and no doubt there were other meetings as well took place directly between our solicitors and the Scottish Government on this subject of what is the scope of this inquiry, what should it look like. And I would say that our offerings were well received. We genuinely felt we were contributing. It wasn't a tick box exercise. We were contributing to the scope because we knew the experiences that our members had gone through, and so we were covering a lot of bases early on.
In paragraph 76, you mention the point that you in fact just told us about, that you maintain that it was the former First Minister saying that she would give us a Scottish inquiry that forced the former Prime Minister the UKI.
I do.
And you also say that had been fended off, I assume by Boris Johnson.
Yes.
During 2020.
As I say, 5 times they'd asked, and by the time we met with the First Minister, it was actually 6 times he had rebuffed them, including the infamous, there's a clip where he's asked, why won't you meet with with the COVID bereaved families, and his response is, of course I'll meet with bereaved families. He left out the word COVID. I picked that up straight away, but that was him saying, of course I'll meet bereaved families. Not necessarily COVID families, but I'll meet bereaved families. And he did meet some COVID bereaved, but I think they were all rather sympathetic to his party's cause, you know.
Okay. Really, just to get that gives a little background to your role. If we can consider that, Dr. Wightman. But can we now go back to the circumstances that have led you to being here? And
yes.
Those are in relation to the death of your mother.
Yes.
You tell us a little bit about her, and reading short, and I mean no disrespect to either to your mother or indeed to your late father in doing this, but the family in which you and your younger brother were brought up was, as you put it, quote, a normal working class background in a mining town.
Yes.
And I assume that's a mining town in Fife.
Yes.
Yeah.
Yes.
And you describe your mother and your father as very different characters.
Yes, and Dad was quite a calm man, didn't speak a lot, but he was a really good judge of character. And it's very difficult to rile him. Not that we tried, but I rarely saw him angry. He was the calming influence. Mum was a little bit more flighty, a wee bit more emotional, maybe. But between the two of them, they made such a blend. And I realised I haven't said much at all about either of them in this written submission. So if I could just speak a wee bit more about the two of them as a couple. They'd met. My dad didn't go down the mine. My dad became apprenticed to a painter and decorator firm, and he was once he was qualified. He was trusted with the works van, much to the annoyance of older and longer-serving members of the organisation. Why are you giving it to the laddie? Because I can trust him, was the response. But they used, and Mum actually worked as a shop assistant in the painter's shop. In those days, painters did actually have shops on the high street.
I think I can probably, I'm old enough to remember that, believe it or not.
So Mum worked there, and that's how she met Dad. And so they became an item. They're both very keen dancers, so they would go to Kelly dancing. It wasn't the formal Scottish country dance, it was a wee bit more loose than that. But they very, very keen, and every weekend they'd be out to some dance somewhere or other. And of course, Dad, using the van, would run them all to different towns, different locations. So they became quite widely known in their youth. And then when the two boys come along, they signed Mum stopped working, became a full-time mum. They didn't have the time to go dancing so much. But once my brother and I were up and raised, they went back to the dancing. And it was very rare. And my wife just reminded me of a story. I wanted to tell one about both Mum and Dad, but I might accidentally name my dad in telling it. So I'll tell this other story. We took Mum, by this time she was widowed and living on her own, and she wanted to go and see Andre Roux. So he's coming to the SECC in Glasgow. Let's go, take Mum and see Andre Roux. So we're way out of Fife, we're through in Glasgow, we're in this big auditorium, there's 8,000 people, whatever, and we're way up in the gods. And we go in along the top, down the steep steps, help Mum down, shuffle her into a seat. She sits down, ready for Andre Roux. And this woman leans over and taps on the shoulder. Hello, Ellen. Yeah. She was just one of these people. Anywhere she went, somebody would know her. And Dad was the same. You couldn't walk down the street in Fife, but somebody would be shouting hello to them. It was incredible. Very sociable people. And of course, Mum working in the local shops was known throughout the community as well. And in those days, it was more an Arkwright type. Behind the counter, you asked for what you wanted. You didn't go pick it yourself. So, yeah, that's a flavour of who the two of them were.
Well, thank you for that. You personally moved away to pursue, as you've told us, your academic and then your professional career. But I think your brother always lived close to you.
He always lived in Fife, yes. Yes.
And I think you tell us that your father sadly died in 2016.
That's actually a typo. It's 2015.
15.
Yes.
Thank you. And
yes.
He had dementia, and your mother had looked after him until the end of his life. Is that
she'd
right?
looked after him until, I think, not quite 2 years before he died. And he just, I've heard some of the other witnesses speaking about dementia in the family, and Dad would wander. He would get up at 3 o'clock in the morning, go for a shower and get dressed, ready to go out to his work. Mm-hmm. And sometimes he would just leave the house and he wouldn't have said where he's going. And my brother and my uncle would be driving round looking, where's Dad gone, you know. And so it became a problem, and to a point where Mum was getting worn out with it, and we had to put him in the care home. Mm-hmm.
And I think your mother was also diagnosed with dementia. You tell us about that in paragraph 12, after the death of your father.
And I think, I've been thinking about this a lot recently. I don't know if some of the origins of that might have been showing themselves while Dad was still alive, because Mum got really, really anxious. We'd put them in the care home so she could have a bit of her own life, and yet every day she would go to the care home to see him, and she wouldn't always come out happy, because maybe another resident had said something or a nurse had said something to her, and it was just anxiety. And I wonder now if some of that was the beginnings of dementia in Mum as well. But once Dad died, we went to see Mum every week, and my brother would be there. My uncle would be in every day looking after his older sister. And, you know, for a while, she seemed to almost kind of get used to it. But then, whether it's being on your own all the time, she started to become really, really anxious. Yeah. Phoning her brother. I mean, I remember one incident. There was a piece of furniture, and Mum had been dusting around. She'd looked down, and here lying on the floor was a screw. Oh, where's the screw come from? Where's the screw come from? She on phoning my uncle. He had to go around and assure her that the house wasn't about to fall down, you know, that everything was fine. It probably didn't even come from that piece of furniture. It maybe been lying there for a long time. But it was little things like that Mum would be worried about, and quite anxious on the phone, and it became apparent.
And I think you and your brother at some stage obtained a power of attorney in relation to your mother.
Yes. We'd actually put that in place when Dad was diagnosed with dementia, but they had the foresight to make it for the both of them, or two separate powers, whatever it may be. But yes, that had been put in place in advance of being needed, really, in the case of Mum.
You tell us in paragraph 14 that your brother was in fact the primary carer for your mother.
No, again, that shouldn't say primary carer. He was a primary attorney.
Attorney, right.
He didn't do any of the caring.
Physical caring,
It was attorney. So anything to do with Mum's affairs, my brother was the point contact,
right,
because he lived closer.
Yeah.
And over the years, that had been the way things were. He was the one that was nearest. I was always the one that's furthest away.
I think after finding a mother in a slightly distressed state, your brother was able to arrange for her to go into respite care.
Yes, and this is where it,
March 2019.
ironically, because Mum, it was a semi-detached house over 2 floors, and bedrooms are upstairs, the bathroom was upstairs. And my brother said to me at one point, I'm going to go in there one day and find her lying at the bottom of the stairs. So he'd found her in this very distressed state. He'd arranged for respite care. And ironically, the very first night she's in the care home for the respite care, she falls and breaks her hip.
Yeah.
She then goes to Victoria Hospital. The hip operation is done. It's a success, but she's not waking up. She's not waking up from it. She's got delivery. I remember going to see her, and she's lying there, and I went over and spoke to her, and then she grabbed my finger and she's rubbing her nose. It's crazy. What are you doing? I took no, she's grabbed the finger, rubbing the nose must have been itchy, but she was using my finger to scratch it rather than her own. It was a bizarre moment, and I thought, are we ever going to get you back? But after about 2 weeks of delirium, she did come round, and then she went to a convalescent hospital for about 5 weeks, and then she went to the care home.
Yeah.
And in the care home, I have to say, we got our old mum back. She wasn't anxious. She was being looked after. Someone was there to tell her when it was time to eat, when it's time for medication. Someone would help her bathe. And we got mum back, and it was lovely.
And I think you say, coincidentally, the care home where she was placed at Scooney Care
Yes.
Home in Leven was one that you had, in fact, looked at earlier when you were considering a care home for your father.
That's correct, and that was the one, if I'd had a free choice, that was the one I would have put Dad into. But at that point in time, they said the ground floor was not secure, and Dad was recognised to be a wandering risk, and therefore he might escape, and they couldn't be responsible for that, so they couldn't take him. That feature was subsequently addressed, and to make it secure.
Okay.
And by the time Mum went in there, it was a secure unit.
Just a few observations, if you may, about your mother's care pre-pandemic. You say in paragraph 21 that while you had some issues with the care home, you conclude that it was well run and the residents seemed happy enough.
Yes, I would pay keen attention when we went in to visit Mum. She was often sitting in the lounge with the other residents, and I've always had one eye on Mum and the other eye on the staff interacting with the other residents, and everything seemed to be done with genuine care. There was empathy between the staff and the residents. The complaints I had were, I would say they're minor. I don't necessarily mean minor, but the fact of not having enough activities is common. That's found in a lot of care homes. There's not enough stimulation, and what dementia patients need is stimulation.
Yeah.
But that means you have to take on extra staff, and that costs more, and councils won't pay the going rate and all the rest of it. And then the business of not changing the hearing aid batteries. The number of times I had to ask, and they said, yes, we'll put it on the care plan. And it'd be fine for a month, 5, 6 weeks. And then suddenly you'd find they weren't doing it again, and you have to remind them.
Yeah.
She can't hear you. Can you change the batteries? Okay. Aside from those, I really had no complaints.
Okay. One of the points that we've heard a lot about, you refer to it later in your statement at paragraphs 87 to 90, and we will look at it when we come to that point, is DNRs. You had a DNR as part of your mother's care plan in the care home, as I understand it.
We did, because we'd been through that with Dad, and my mum could be quite direct, and I remember driving down from Forford to visit her one day, and walking in through the door, and this is at a time when Dad was just gone into the care home, and I just got through the door, and she turned around and said, if your dad collapses, do you want him revived? Is it all right if I take my jacket off before I answer that? But yes, we decided it was appropriate in Dad's case, and it was appropriate in Mum's case too when it came her time to go into the care home. So we were quite happy to sign these things. We discussed them and said, okay. And on the understanding it is what it said. Do not attempt cardiopulmonary resuscitation. It does not mean don't give them any treatment.
Yeah. It was specific to that form of resuscitation.
Yes.
You also tell us that it was for you really to contact the care home to go to obtain updates in relation to your mother's condition, but occasionally they would be proactively reaching out to you and telling you if there were any issues that they felt you should be aware of.
Yes, I think there's one occasion they phoned up and said, hello, it's the care home here. Just nothing to worry about, but we noticed that your mum's big toe was looking a bit red and raw today, so we've got the GP to come in, and your mum's going to be getting antibiotics for a week. Is that okay? And just little things like that, they would tell us.
Yeah. And I think that perhaps takes us to another point about the availability of medical professionals within the care home. I think you've made the point in that very answer, but you also make it in your statement that there was a GP surgery that covered the area, covered the care home.
I'd like to make it clear that this was a care home and not a nursing home.
Yes.
Because there is quite an important distinction.
Obviously.
But there was a GP surgery that served that care home, and that GP did. That GP grouping did support the care home, and there was never a problem that I heard of if somebody needed to see a GP, they would come to the home.
And I think you will go on in your statement to talk about the GP care that was afforded to your mother in the latter weeks of her life. And I think I remember reading in your evidence to the UKI, you praised the GP service that was provided.
Well, I've become aware of all the stories that we have in the group, and I do try and get at least the basic story from everyone who joins the group. It's not nosiness, it's wanting to understand how many different categories do we have in this group, what's each individual, just skeleton story. I don't want detail, I don't want chapter and verse, just the basics, please. Are we talking care homes, are we talking hospital acquired, is this infection at work, and that kind of thing, is it community acquired? Just a general feel for who we have in the group. Sorry, I think you asked me about the GP. In the time of COVID, that GP was close to retirement age and subsequently did retire when it came to a quiet period after the initial COVID. But that man went in when he was needed. He put himself at risk. Mm-hmm. He didn't have to, but he did it.
Yeah.
A sense of duty.
Yeah. Yeah.
And we were lucky.
Yeah. I think we've seen that referred to in your UKI evidence. Yes. So we have that, Dr. Wightman. Right, can we bring you to the circumstances of the pandemic, please? And you deal with this at paragraphs 25 and following of your statement. You had been following the developments of the pandemic in China and then in Italy and Spain in early 2020. And you talk about this in paragraph 26.
Yes, I've got.
As a scientist, what was your reaction, bearing in mind you had a mother in a care home at the time?
I just noticed I've got January 2019, it's clearly not correct. But yes, because it started in December 2019, we started seeing the footage from China.
Yeah.
I watched in horror at what was going on, and the pictures from China were absolutely scary. And think, wow, I hope this thing doesn't go any wider. And then it was going wider. The next thing you know, it's in Italy, and Italy's locking down whole regions, and the hospitals are getting overwhelmed. And then the story started coming out of Spain about care homes and staff being too afraid to go in and tend to the residents and being left basically to die. And it's horrific. And I'm thinking, surely we're going to do something here. We must do something. This is coming our way. And there was nothing apparent happening from our government. I mean, primarily the UK government, but there was nothing happening in the Scottish government either that I could detect.
When you say there was nothing happening in relation to either the UK or the Scottish government, what particular failings were you thinking about in saying that?
Well, we're an island, and yet we continue to allow flights to come from China and from Wuhan into the UK and import the virus into the UK. And then there are other instances of, I think the super spreader, as he was called, had been in China at some conference. He then stopped in the Alps, the town Alps, on his way home, and he'd gone back to the UK and into his local pub and infected everybody along the way. He was perfectly fine, but he was infecting and shedding virus to all those around him. And I'm thinking, how much warning do you need? You know, this. I know some of the scientists have argued, well, locking down doesn't prevent the virus from coming in. Well, how not? How do you think it gets here? You know, it's not carried on the gentle breeze. Well, not very far. Inside the room, maybe, but it didn't waft its way from China. It came inside people who were on an aeroplane and flew into this country. How do you think it arrived? And I just couldn't believe we were doing. Virtually, we're doing nothing. Maybe asking people, handing out leaflets at airports, if you get a cough or a temperature, you should really think about maybe isolating. Is that the best we could do? Really?
Yeah, and one of the things this inquiry is going to have to grapple with is the benefit of hindsight. This is something that you're indicating was in your mind at the time, is that right?
Yes, and my stock answer to people who say, oh, this is all hindsight, my answer is, no, it was lack of foresight. That's what caused it. This is not hindsight. This was all obvious to me, sitting in the House of Forfar watching news programmes. I didn't have teams of medical specialists or scientists advising me, but I could see what was happening. How did the government not know what was coming?
Did you have to have a scientific background in order to do that?
I don't think so. I think you had to have a large dose of common sense and a bit of life experience to see this was coming, and fast.
Okay. Right, can I take you on to communications that you had from the care home? Paragraph 29. you tell us that you got an email from the care home, your mother's care home, saying that it was going into lockdown and that there was to be a restriction on visiting. The exceptions were to be, as you put it, emergencies or extreme circumstances. Now, you say in paragraph 30 that there was not a definition of emergencies or extreme circumstances.
No.
But you applied, I presume, your common sense as to what those amounted to. Generally, what was your reaction to that approach being taken by the care home?
I welcomed it. I thought it was the right thing to do. Because we had some of the most vulnerable people in our communities inside care homes. Frail people with comorbidities. If that virus got in, it was going to devastate that population. So I was all for keeping it out. And so I welcomed the fact they were doing these restricted visits and putting these limitations on, although they might need some interpretation. I mean, for me, an emergency isn't that, oh, my mum's run out of her favourite soap. But an emergency might be, my mum's had a suspected heart attack, she might need to go to hospital. That could be an emergency. Or she's about to breathe her last breath. That might be an extreme circumstance. But apply a bit of common sense. It means don't go in unless you really have to and you can't avoid it.
In that context, did you have regard to the impact that restrictions on visiting would have had or did have on your mother?
At that point in time, no. I think I say this in the statement. Yes. I was 100% for restrictions because I wanted to stop the virus getting into the home. Because once it's in and it's circulating, it's good night for so many of the people in there. And I backed it, and I subsequently have learned from listening to care home relatives and others that the impacts were not all beneficial. The impacts were negative on the residents, even if they didn't catch COVID, and particularly for dementia patients. And I think I would soften my approach now, but I think I'm not going to second guess my feelings at that time. I would stand by the decision I made in the circumstances that I made them. I was all for keeping those out of the home.
Yeah. I think you make these points at paragraphs 32 and 33 and 34 of your statement. I think you've...
Yes.
Yeah, I don't think it's necessary to go over that in any more detail, but thank you for that. You have given us a section on PPE and infection control at paragraphs 35 to 39. There's just one point I'd like to, because we can read what you say there, there's just one point I'd like to take from you, and that's what's in paragraph 37, where you say that you were told that the home was not taking any new residents after lockdown. Did you ascertain whether the home was taking in any residents or patients from hospitals?
That's why I asked the question about taking new residents, period. Because that would also include taking them in from hospitals. I didn't ask that. I don't think I asked the question directly about hospitals. I asked, have you taken in any new residents since your lockdown? And they said no. So that includes discharges
wherever
from hospitals, as far as I'm concerned.
Okay. Thank you. Now we move on to the section of your mother becoming unwell. And again, I don't want to take this in perhaps detail, because we do realise it will be upsetting for you.
Yes.
But really this began, I think, on the 20th of April, where you became aware through a rather circuitous route that your mother was unwell. And you tell us about this in paragraphs 41 and 42.
Yes. Well, my brother received a phone call from an NHS doctor asking to speak to Helen Wightman. And my brother said, well, she's not on this number, but I'm her son. What is it? And he said the care home had called him that morning because Mum wasn't very well. And the care home had been looking for advice. Mm-hmm. Now, he did say this, that he found it very difficult to understand the doctor's accent. So I think what the doctor may have been saying was he was asking for Alan Wightman, not Helen Wightman. Right. Because I did have a German colleague at one time who phoned the home and asked to speak to Ellen. And Anne said, Ellen, there's no Ellen here. No, Ellen. No, Ellen. Oh, right. Yeah. So it could have been that. But anyway, they phoned asking about the care home had been on, presumably to NHS 24 or some such, looking for advice. So my brother then phoned the care home and was told, yes, we couldn't waken your mum up properly this morning. She was described as listless and sleepy. But she didn't have a fever, and at no point did she have a fever. The temperature was raised slightly, but was within normal bounds, and the doctor had said, well, it's rest and fluids, which is usually the go-to thing for any ailment, is rest and fluids.
Was there any question of hospitalisation discussed?
No, that was not discussed at any point, and I was pretty convinced I would have pushed back against it anyway, and I'll explain why when we get there. But to follow, 3 days later, the GP was sent for because the care home staff had heard what they described as a crackle in Mum's chest, so some sort of ruckle or noise in her chest. And he came in and prescribed antibiotics. Here's the section where I say it's not appropriate for. There was no discussion on why hospital was not appropriate at this stage, but I would have pushed back and said, I don't want her going to hospital. She has dementia in a hospital ward, a non-specialist ward without dementia carers. She'll be completely, she won't know anyone. She won't know what's going on around her. And there was so much COVID circulating in the community and COVID appearing in the hospitals. I felt the care home was a safer option. So I did not want her to go to hospital.
Mm-hmm. Okay. At paragraph 47, you tell us about the first of the cardinal COVID symptoms, which afflicted your mum, and you mentioned that a senior carer who had been absent for a few days had noticed a very serious deterioration in her condition.
Yes, this particular carer, she had been on holiday, she hadn't seen Mum, but she used to, whenever I'd go in to visit Mum, she would say, oh, your Mum's lovely. I call her my wee pet. I'd just love to take her home with me each night. She really had a bond with Mum. And she'd been on holiday. She came back and she, oh my goodness, look at the state she's in. And phoned to get a GP back. She couldn't believe how much change there had been in Mum in the 2 weeks that she hadn't seen her.
Just on access to your mum at that time, were you able to get into the care home to see her?
Only under the
criteria
if it's an emergency.
Yeah.
We decided it wasn't an emergency, and Mum was described as not properly wakening up. Now, I can go back, and I've already told you when Mum broke her hip and spent 2 weeks in delirium, and I thought, she's never going to come round. Prior to that, what finished my dad off was he had a fall in his care home, broke his hip, went in, had an operation, sent him back to the care home. Dad never recovered full consciousness. So I knew that the chances are here, Mum might not wake up. And they said to me, look, you can come in, but you'll be fully PPE'd up. You'll get 15 minutes. If your mum's asleep when you come in, we won't wake her, we won't try to wake her. And we just felt, what are we adding there? And I also tell people this, and my mum I told you she could be quite direct. And I remember a number of occasions where I would report I'd done something and it didn't turn out right. And then she would just turn around and go, that was awful silly, wasn't it? And I could just picture my mum, if my brother or I, the family had gone in to visit her and we'd been infected and we'd subsequently had serious illness or lost our lives, I could just picture my mum saying, that was awful silly, wasn't it? Why did you come in? You know, you knew there was a risk. Why did you do that? So I and my brother decided we wouldn't go in. And I don't think any member of the family went in at all during those times. They weren't supposed to anyway. They'd been asked not to do it. So we didn't go.
With the deterioration in her condition,
yes,
I think there was something called hospital at home
yes.
care that was offered. This is
but that's
something from
yeah.
the Victoria Infirmary in Kirkcaldy, I think.
That's right. The first application of antibiotics hadn't worked, hadn't been successful, caused Mum terrible diarrhoea. She's always had a problem with taking antibiotics in that regard. So they'd stopped, and this had dehydrated her. So they decided that she needed intravenous fluids and perhaps intravenous, I think they stopped all the antibiotics at that time, but she needed fluids and so they said, well, we can't do it, we're not a nursing home, we'll have to get hospitals at home to come out. And they came out 3 times a day from Victoria Hospital. I was so much happier that they did that rather than say, we're going to send your mum to Victoria. I would not have been happy with that.
Yeah.
So she got hospital care in a care home setting in her own room with people that she knew round about her. For me, that was the best option.
Okay. Things escalated thereafter, and part of the information that you obtained was through the local newspaper, the Courier, about
yes.
An outbreak of COVID within the home. And as you tell us in paragraph 53, there were 16 positive tests in your mother's care home.
16, and at that time the number of residents was 35.
Now, your mother wasn't one of those who was included in the 16 because her test was inconclusive.
That's correct. And she was tested twice, and both times it was inconclusive.
Yeah. How did you feel about obtaining that information through the newspaper or from the newspaper?
I think I took it better than the chief nurse and de facto deputy manager who had to phone me and tell me. I think she was very upset that having to give this news. And we don't know who leaked the story to the press, but somebody in the know leaked the story about the number of residents. And the story at that time, I think, said there were 2 dead. And she said, well, it's actually worse. There's now 3 dead. I felt for her because she genuinely did care. I told you that Mum had been a keen dancer. And there was one day in the care home, they had musicians in to play, and Mum had got up out of a chair and was standing herself and just moving gently side to side. And this lady had gone up, the carer had gone up and took Mum's hand and had a dance with her. And she said, she cried going home because she was able to do that for Mum. And I thought so much of her for doing that for my mum. To take her up and dance and say, she just came alive. She just came alive. She danced. That meant so much to that lady. And now she was phoning me to tell me we've got COVID in the care home and we've got deaths. I felt for her.
Appreciate this is upsetting for you, Dr. Wightman. I'm afraid that where we're going is probably not going to be any better.
It's becoming clear, I hope, that I bear no malice to the care home and the staff whatsoever. I think they did an amazing job in very, very difficult circumstances, and they shouldn't really have been put in that position in the first place, because we should not have allowed this virus to circulate. Let it rip, indeed.
Yes. Can we perhaps take things short? There was consideration given by you and your brother as to the continuance of the hospital-at-home treatment over a few days. And then because there was your mother's condition continued as it was, on the 4th of May, you were asked whether you would agree to the cessation of this treatment, and you agreed to that. And I think you say in your statement that you'd had an extra 11 months of your mum after the incident that you referred to earlier when she broke her hip.
The broken hip incident, we were summoned and said, look, we've fixed the hip, but you better be prepared for the worst. We don't think she's going to survive. Okay. And so to get her back and to see her happy again and settled, and to get a bit of mum back for another 11 months, I'm grateful.
Again, taking it short, I think, Doctor, the treatment was withdrawn. You had concerns whether you had done the right thing, as you say, at
There was another close family member said to me, I think on the Tuesday or the Wednesday morning perhaps, oh, God, have we done the right thing? And I said, yes, don't be in any doubt, we have done the right thing.
And I think, again, I think it's best we take this short, and again, it's no disrespect, that you were phoned by the care home at 7 p.m. on the 6th of May to say that your mother had died.
That's right. And as I say here, to be honest, it was a relief. It's because she was no longer suffering. And that's all we had wanted for her, not to suffer. But she was a tough one. I mean, 88 years old. I think she was about 6.5 stone when she died. She had a bent over with a big dowager hump on her back, breast cancer, deaf. But God, she fought those last 3 days to stay. But you know, there was no good outcome. Not from where she was.
No. You deal briefly with bereavement, and you tell us at paragraph 65 that her death certificate noted suspected COVID, and that I think is a reflection of the fact that the test was still inconclusive.
The test was inconclusive, and I think we skipped a paragraph where one of the doctors from the hospital would explain to me how a test could be inconclusive, and so I understood that. But the GPs, one of the doctors from Kirkcaldy said did the hospital at home thing, said, "Don't you be in any doubt. This is COVID. I've seen enough of it now to know." And the GP.
Yeah.
But because the test hadn't been positive, they had to say it was suspected. But they said, there's no doubt in our mind, this is what it is.
And again, you tell us about the restrictions at your mother's funeral, which is something that we've heard a lot about in the inquiry so far. 6 people were allowed, and I think also one of the invidious situations you were put in was in relation to your uncle.
Yes, my uncle was about 14 years younger than my mum, and so when he was a child growing up, he almost had 2 mothers. He had my mum and he had her mum, and his own mum, and there was a bond between the 2 of them that was strong right through their life. And he had given up a lot of his time when Mum was at home before she went to the care home, going up every day and just seeing that she was okay. And it seemed only fitting that he should be included in the 6. So they had my brother and his wife and 3 of their children, plus my uncle, was the 6. And I decided I would give my uncle the place, which I did happily. Now, unfortunately, on the day, they would not allow him into the crematorium because he was over 70. And that was, not only was it 6 people, but nobody over 70 allowed in. Yeah. So his son ended up having to go in his stead. But I did get to write the service eulogy for my mum. The celebrant read it out very nicely, and it was streamed, so I was able to follow that and also record it and keep it. I think I may have watched it once since, but I don't keep going back to it, but I know it's there if I need it. I think I honoured my mum in the best way that I could at the time. And I'm quite at peace with having done that.
Lord, I wonder if we could take a short break at this point.
Of course. About 15 minutes, Mr. Gale?
That'll be plenty, my lord, yes. Thank you.
Thank you. By all means.
Right. Dr. Wightman is back in the room, and we're in a position to recommence.
Very good, Mr. Gale.
Dr. Wightman, can I take you to the section of your statement which gives an overview of members' concerns and impacts? And this is at paragraph 77 and following.
Yes.
Now, having read through what you've said there, I think I should say that a number of the impacts and concerns that you do refer to are matters that the inquiry has heard from other individual witnesses, and also have read statements from various people which you incorporate within here. But I don't wish to, again, I don't wish to foreshorten matters. You look, as you say, chronologically at the first concern of the members was that of care homes, and you say that it was a huge scandal at the time.
Yes.
You also use an expression that you referred me to earlier when you said you were not buying into the concept of hindsight.
Correct.
Can you just, again, for the benefit of the record, can you just explain, perhaps in a little detail, what you have in mind in that paragraph?
There's been a lot of talk about, oh yes, looking back, in hindsight, we should have done things differently. You were the government. You had access to experts and specialists. You did pandemic planning exercises that were meant to have actions coming from them that would equip the country to meet challenges of various types. I'm not buying the hindsight thing at all. It was lack of foresight. If we'd have stuck to those pandemic plans that were devised, and there were lots. I heard a lot, again, sorry, I'm going to have to go to the UK inquiry, but I've heard things about task and complete groups, or task and finish groups, that seemed to start a task, but didn't seem to finish it. Well, there are many reasons for it. I mean, not the least of which is austerity, I guess, and that's the reason for running down stockpiles and privatising left, right, and centre people who said they could do a job more cheaply without necessarily committing to the quality of job that is done. And I'm thinking in this instance about the management of PPE, the stockpile. So there were many things that could have been done differently had the pandemic preparation exercises been followed through to some kind of logical conclusion and plans on the shelf. Now, I also agree a plan's only as good as the day it's written, and it may not apply in the real circumstances that hit you, but you've got somewhere to start from. Instead of just starting from, gosh, what do we do now? You know, we've got this thing rolling towards us. What are we going to do? And
I suppose also a plan is only as good as its implementation.
that is also correct. That it's all very well having the plan, but if you have no means to put it into practice, then it's not worth very much.
Yeah. You do use the word scandal, and I'd like to just explore that with you a little. Why do you use that word?
Because we, and I think I said this earlier, well, in fact we say it here, we saw what happened in Italy. We heard reports coming out of Spain that care homes in particular the elderly were just being left to die in Spanish care homes. The workers were so scared to go in, scared for their own lives. This is all well documented and reported at the time. Why did we think somehow we would be different? On what basis would this not happen in the UK? Where's the evidence that says we're going to stop this thing from happening in the UK? But by what means? A wing and a prayer? Hope? You know, there was not enough foresight of this thing's coming, how are we going to stop it? It seemed to be all about, well, it's coming, there's nothing we can do, let's try and mitigate it, and but let it flow through the population. Fastest way of getting immunity, blah, blah. The whole ethos was just wrong. And I still say it's a scandal what happened in the care homes, because we did have a model several weeks ahead of us of what is coming your way. But we didn't do anything to mitigate against it.
In the following paragraph, you express sympathy with care home workers.
Yes.
And I think what you do is contrast their position within the care home sector with those workers within the NHS. Can you explain why you do that?
Well, I wasn't around when the NHS was born, but I believe it was meant to be from the cradle to the grave, healthcare. Now, somewhere along the line, we detached part of that from the NHS responsibility. And if you're an old person needing care for dementia or something else, this is no longer provided by the NHS. This is now something called care. And we get that off the government books by privatising it. So it was all very well protect the NHS. Where was the protection for care? It didn't seem to exist, other than perhaps in the mind of Mr. Hancock. And once, well, it's private providers. We don't have to. They're responsible for their own business. They can source their own PPE. And many care homes didn't get any help to get PPE from the central government for quite some time, and some way into the pandemic. Probably by the time wave one was subsiding, they started to get help with PPE sourcing and provision. And similarly, it's the care. Oh, that's local government looks after that. That's nothing to do with central government. Let them sort it out. They're responsible for that. To me, there was a completely callous attitude on central government rolling responsibility away from themselves and saying, that's somebody else's problem. We're going to save the NHS. The NHS was meant to save us, not the other way around.
Just looking at the position and role of workers in the two sectors, which is how you begin that paragraph. It's perhaps reflected also in the fact that in your discussion with me earlier about the care that was afforded to your mother,
yes,
you don't criticise in any particular way those who worked within the care home sector. Do you feel that, as a generality, that they were unfairly either treated or castigated?
I think, yes, they were. We seem to think that it was okay to treat care homes as if they were isolation hospitals. Yeah. We could take these COVID-positive patients who didn't really need to be in hospital, out of hospital, to make way for the next wave of COVID patients that would be coming in and would need the beds. And where do you stick them? Well, let's stick them in a care home. Why? A care home exists, and its function and its ethos is the residents should not be isolated. They should mix with each other. They should mix with staff. You turn that completely on its head, and now suddenly they've got to be isolation hospitals. And they don't have nurses, a lot of them. So how are they going to achieve this? This was never explained to me. How is a care home supposed to turn itself into an isolation hospital? It makes no sense to me, and it was a scandal. I've never yet seen any piece of evidence from anyone that says this was a good idea. Your common sense, again, forget the science. Common sense says you do not put people who are infected with a highly contagious virus for which we have no treatment, for which we have no vaccine, for which we have no cure, in amongst your most clinically vulnerable people in society. That's madness.
You also mention the situation of medical care within care homes in paragraph 79. To a certain extent, we've already touched upon this. Again, you've praised the GP whose services were afforded to your mother in the care home, and
Yes.
also the hospital at home service.
Yes.
But you indicate that that was not always the case, and this is material that you've obtained from your membership, I think. Is that right?
Yes. Yes. And I can recognise one of those examples as someone who has already given evidence to this inquiry in their own right.
You go on to say in paragraph 80, to me the biggest failing of all has been in the hospitals, with COVID being able to circulate pretty much freely in the hospitals.
Yes.
And I think you make the point that within your group, 3 times as many people have been bereaved from hospital-acquired COVID compared with those who have been bereaved through care homes.
Yes, I think the latest stats that I saw last time I ran them was 25%, 1 in every 4 of our members lost somebody because of nosocomial infection. So they went into hospital for one reason and they were infected with COVID whilst in there and they didn't survive, versus 9% typically for care homes. Now, that's why I say it's 3 times bigger. If it was a scandal, what happened in the care homes, it's 3 times bigger a scandal what's happened in the hospitals and how we've not been able to control the circulation of COVID within medical settings.
And the point you make in paragraph 80 is that you say it would appear because we've forgotten all we ever knew about infectious disease control. Can you explain that a little more, please?
When my mum was a girl, she had, I think it was, I'm going to say it was scarlet fever. I may have got that wrong, but she had a disease, and she was taken from the family, taken to an isolation hospital, and she said that her dad would cycle out from his home after work out to the hospital every day to see her, and he put little toys on the window ledge. That was harsh, but that was an isolation facility. That was take this person out, put them on their own, give them nursing care, but separate them, stop this from circulating. That's an extreme case, but I don't think we do this anymore. We've got numerous examples, you will have heard some of this, about people wandering from red zones to green zones in hospital without changing PPE, sometimes without any PPE. Maybe not medical staff, but support staff, technical staff. Someone come to change a light bulb, someone come to empty a bin. There doesn't seem to be... I go back to an example that maybe is never a real one, but you know, I remember watching old black and white films where they had a matron who was in charge of a ward, and that matron was nearest thing to God. What she said went, and nobody dared to deviate from that. It seems to be very lax now. That people just there doesn't seem to be the control there anymore that there used to be. As a complete layman in this matter, and just observations I've made in the rare occasions I've had to go in the hospital myself.
The domiciliary care that you refer to in paragraph 81, this is again something that the inquiry has heard about and will continue to hear about.
Yes.
And the lack of care in particularly for disabled people within their own homes.
Yes.
You say, reading short, that all of that should have been foreseen. This is the last sentence in paragraph 81.
I see, yeah.
Why do you think that in relation to domiciliary care it should have been foreseen in particular?
It's another way of providing care to people that need it, but in their own home. So it's a far, if we get to the pound signs, it's a far cheaper way of providing these people with the care that they need than putting them into an institution where they probably don't need to be. They just need a little bit of help to stay home. But of course, that means that these people that are providing that care are going home to home to home to home. So they need to understand how to control infections and what appropriate equipment to wear to stop the spread. It's a big part of provision of care. Not everybody has to go into a care home. And why were these people not thought about more in the planning?
Again, you're taking, as I understand it, instances from the membership of your group to inform what you're saying here. Just one point I'd like to ask you about is that you say within that paragraph 81 that people were afraid. Now again, this may seem very obvious, but what was it that was causing that fear? Was it the messaging? Was it the non-availability of services?
The fear was this thing kills. It transmits readily. It's now in our country. How do I avoid this? And I am someone who's going in providing care to people in their own homes. How am I going to avoid getting this? And there's instances of, I think it was one example, a lady that needed care in their own home and had mentioned to the carer one day that, her grandson had been a wee bit unwell last time she'd seen him. And that was enough on that day for them to say, went back to the office and said, we're not going to that house again because she said her grandson's not well and he's been to the house. He might have COVID. So they just stopped going. And she was left with no help. And that's not right. You can't just abandon people. They needed the care. They should have had the care. There should have been a way to provide that care. And if that was appropriate PPE, if it was more training, or even if it was taking that person into some sort of temporary setting where they could be administered to, there has to be something. You can't just leave people that have been in need of care alone and not provide.
You talk about triage arrangements in a way looking at it from both sides in paragraphs 82 and 83, and I think we can read that. You do give an example in paragraph 83, and I wonder if you'd just read what you say there
In
about
83.
in paragraph 83?
Yes. Then we have the other side of it. No, that's not good English. Yeah. On the other side of it, there were people in hospital for whatever reason, but then caught COVID whilst in hospital. Some had mild symptoms while in there, so they were sent home. Send this 83-year-old man back to his 82-year-old wife. Don't even say he's got COVID. This is a real example of what happened to people who are now in, or the relatives are now in our group, because both of those, the elderly gentleman and his wife, both died of COVID. Because he was known to be infected, couldn't do anything for him, send him home to his wife, don't even say he's got it, and they both die. And that's happened on more than one occasion. I think there are at least a couple of instances in our group where something very, very similar to this was done. And that really should not have been the case.
You mention also the situation of people who weren't able to advocate for themselves and they didn't get the treatment they deserve. This is paragraph 84. And I think you give a specific example of that subsequently in your statement at paragraph 94.
Yes,
you talk about one of your members having a non-verbal younger sister with learning difficulties. Can you just tell us about that, please?
I only know the skeleton story here, but it is as it says. She was basically her sister's advocate. The sister needed to go into hospital. I don't necessarily know the underlying reason why she needed to go in, but so she went in with the sister, stayed there for 3 days, and after 3 days was shown the door. Now, I could read between the lines and say, well, maybe she was too demanding, maybe she overplayed. I don't know that, but anyway, for whatever reason, she was ushered out. And when the hospital phoned and asked her to come back in because her sister wasn't going to make it, she got in there to find the sister was in really terrible, terrible state, basic care clearly not having been done, basic hygiene not having been done for the sister. And shortly after that, the sister died. So here was someone who should have had an advocate there in the beginning. That advocate was in, asked to leave for whatever reason, and called back in at the end of life. That's she describes on the day she was asked to leave, and the sister was screaming, and she went and knocked on the door and let me back in, and they wouldn't let her in. Now, I've no doubt that situation was difficult for the healthcare staff too, and perhaps they were overstretched, perhaps they're overworked, but it wasn't the right treatment for the younger sister.
Can I move on to paragraph 85 and the question of telephone access and the 111 number, in which you say that your members have told you that appeared to be a bit of a lottery, to a certain extent, depending on who was actually answering the phone, I suppose. Is that right?
Well, again, I think when these phone lines were set up, the idea was there would be a trained doctor or trained nurse there to assist with the interpretation of the incoming calls. But they had to draft, because they needed those people in hospitals not answering phone lines, they needed to bring people in who were used to dealing with phone calls, so people who worked in call centres. And I believe the format was they were given a flow chart to follow. If they ask a series of questions, it will take you down a path, and that will lead you to the answer of what should you do with this caller. And oftentimes there wasn't a qualified nurse or doctor there to go and say, this is where it's taking me, but I don't think this is right. Could you just have a look at this for me? You know.
You give an example in paragraph 86 that has been passed on to you, and you make reference to this in the statement that you gave to the UKI. Could you just tell us about what that record is?
This is as I had understood it at the time I wrote this, but again, one of these relatives has actually given quite a full account of one of these particular stories, and I realised I didn't know the full extent. I did, because I don't ask the full extent. I just want to know the basics. But yes, as I understood it, they couldn't get treatment because they phoned up to get help, and going down through the flowchart, the person who spoke to said, you know, what you're supposed to do is you're supposed to stay home and basically tough it out. You stay where you are. And a lot of that was driven by the fact that they were young, formerly fit men in the late 20s, early 30s. So by the time they actually could get treatment, it was too late. They were lost.
You also have a section on DNAR, DNACPR. And to a certain extent, we've looked at this a little bit in the context of what was in place in relation to your mother.
Yes.
But you do make the point in paragraph 90 that this is an issue that has caused a lot of distress among your members.
It has.
And what is it that you would want to bring to the inquiry's attention about that distress, and what do you feel should be done to alleviate the distress?
I think there are people in the group who can address this far more effectively than I, but there seems to be a feeling that the DNA CPR, which, as we've said earlier, has a specific meaning, in some cases was applied apparently with the consent of the patient, but the said patient had delirium or couldn't communicate effectively, but they had agreed and understood and agreed that this was to take effect. That sometimes the person with power of attorney for medical matters and might therefore have been expected to have signed in lieu of the patient wasn't even consulted. And it's a grey area because what little I understand of it, and this is way outside my real area of any kind of expertise, is the medics will apply this in the best interest of the patient, regardless of what anyone else thinks, close family member or not. I really don't know the fine detail of that. I really don't know. Someone would have to explain that to me as well. But I know it's a matter of huge concern. These things didn't be applied, and the meaning gets stretched. It's not in the case of the heart should stop. Do you want it restarted? It seems to be widened out to removing other forms of treatment. It's almost a do not bother treating, and that was never intended to be that. But as I say, this is well beyond my area of expertise. But there are good people in the group who have the expertise and can assist.
Also, and I suppose it's a matter of largely of communication and advice. You make the point about the distinction between end-of-life care instead of palliative care, and you say that there were situations, this is paragraph 91, you say that there should be dialogue about that.
Yes, and again, it probably comes down to a clinical decision on what is best for that patient as judged by a medical professional, versus what the family member might think. And again, where does all that really lie. It's a difficult enough topic at the best of times, but in the midst of a pandemic, when everyone's overworked and the whole system's about to be overwhelmed, perhaps,
Yeah.
I think there are issues around the ethics of some of these decisions. But again, it's beyond my scope to define it any better than that. I just know it's been a huge concern for our members.
Yes. And just finally, and it is again a matter that we've heard a great deal about, and that's digital exclusion. People who simply don't have access to the internet or have the ability to use devices that would connect them to the internet.
You know, it's not everyone who can go online and book a GP appointment. You know, maybe visually impaired, maybe just not not technically minded, can't do these things. And we all know, I think, the problems of phoning up and trying to get a GP appointment. But this is exacerbated even more because now you're trying to use an online system and you still can't get a GP appointment.
Could we move to lessons learned, please, at paragraph 100, your statement? And you say that the first thing that we've always said we wanted was a factual narrative of what actually happened. And you say it should be stripped of all the spin and the protecting your own backside.
Yeah.
Now, I'm not quite sure whose backside you have in mind, but
whoever is in the frame, whoever had the responsibility for a particular area, why? Tell us what happened, first of all, and then tell us what other options you had available at that point in time, and why did you pick this particular option when others might have seemed more appropriate? That's really what I'm thinking of. But first, you start with what actually happened. And I think a lot of the time you don't get told. And that's back to the Hillsborough law.
We'll come to Hillsborough in a moment. If I can be permitted to make this comment on behalf of the inquiry team,
yes,
I think I can say safely that I can hopefully assure you that this inquiry and its team is determined to produce a narrative based on the information that it obtains and will carry out that exercise robustly and independently in accordance with its statutory obligation. And I hope that gives you a level of reassurance.
That is my understanding of the purpose of a public inquiry, yes.
Okay. Also, that probably follows on 101, who took the decisions and on what evidence should there have been a different route? And again, that is something that, albeit expressed in very general terms by you in that paragraph, you can, again, I hope, be reassured that that will be within the ambit of this inquiry.
Yes.
Paragraphs 102 to 104, I'd like to ask you about, because I think here you are putting on your scientific hat, if I can put it that way, and in particular you are observing that cabinet ministers, and I don't know whether that's UK cabinet ministers or Scottish cabinet ministers or both, but what you say is whatever skills they may have, most of them are not scientists, and most do not give the concept of exponential growth. Can you just explain why you say that, please?
I think people tend to think that growth is a linear process.
Linear,
It's a straight line, and it isn't. Exponential growth isn't that. Exponential growth is a doubling of the number of whatever it is you're considering in unit time. And maybe one way of visualizing this is think of a chessboard, okay? And you put one grain of rice in the bottom left-hand square. You go to the next one, and you double that. That's 2. Go to the next one, that's 4. 8, 16, 32, 64. Before you get very far, you're up in the thousands. And probably the time you get to the top of the square, it's tens of thousands, if not more, millions perhaps. And I don't think the number of times I have heard, and they are UK ones because the Scottish ones haven't been brought under the same scrutiny yet, but they will be, is they seem to think you wait until you know you've got a problem and then you take action. Not with exponential growth you don't, because by the time you've waited to know you've got a problem, it's too late, it's out of control. You have to hit it, Patrick Valence said, hit it hard, early, and for longer than you would anticipate. That's the nature of exponential growth, and that's how a virus replicates. So I don't think they got it. I think they thought it was linear, and you had just had one grain every time you move up a square on the chessboard. No, you doubled the number of grains in each consecutive square, you know. It's a simple enough thing for me to understand, but I don't think, well, they're looking at the evidence of the last couple of days, I don't think the Prime Minister got it. And I think they need to understand that sort of thing. When you're dealing with that kind of growth, you have to go hard and quick. You can't sit around waiting until you're absolutely certain you need to react, because it's too late.
There's also probably an element within that if you don't, as a cabinet minister, understand that,
yes,
then at least you should be in a situation where you appreciate and understand the information that is being given to you by your experts who do understand it.
Yes, and I think there was probably a lot of nodding and yes, right, good, yeah, not having understood what was being said. Now, I think, again, to go to the UK inquiry, I think Mr. Keith at one point was quizzing the scientists on, did you think that the minister you were explaining this to had understood what you were saying? And in some cases I've said, no. Well, then who is the failing with? Is it with the minister or is it with the advisor? You know, if the advisor thought the advice he was giving wasn't clear enough, he should have found another way, or she should have found another way to deliver and make it understandable. Or fail that and go up the chain and say, I'm afraid Minister X just isn't getting what I'm saying. Yeah.
That leads you in paragraph 104 to the view that lockdowns were too late.
They were, and I think the Prime Minister has even conceded that now, that yes, they were too late because of exponential growth. If you hit it hard and early and for a little bit longer than you like, you save a much longer and bigger and deeper lockdown later on. And that, well, I know we're heading on to something else in a minute, so I'll wait till we get there. But
okay, the third lesson that you refer to in 105 is the precautionary principle. Now, for those of us who've spent some time in our careers doing environmental law and planning law, the precautionary principle is something that we are very well familiar with. Can you explain how you see its application here?
The example I give here is discharging people into care homes without testing. Now, as I think I said earlier, I haven't found anyone yet who stood up and said, Yeah, I advocated that, and I said that was a good idea based on this information. I think people were going on a bit of a wing and a prayer that if we do discharge these folks from hospitals into care homes, and if the care homes know how to isolate them, and if they've got the right PPE, and if, we won't have a disaster. Well, you've got so many ifs in there, you're going to have a disaster. The precautionary principle says, I think I said that again earlier on, do you really think this is the right place to be putting highly infective people in amongst your most vulnerable population? Does that seem sensible to you? Is that, wouldn't you have a note of, let's hang on a minute, let's think about that. No, couldn't we put them somewhere else instead? You know, why, I'll never understand why care homes was felt to be the right place to put these people, because it's balance of risk. Now, it might have worked, and there might not have been deaths. As it happens, it didn't work, and we had thousands of deaths, tens of thousands of deaths across the UK of people in care homes, because they just thought, well, it's risky, but let's do it anyway. That's what I mean when I talk about the precautionary principle there.
Yes. In simple terms, does it involve, in your view, the identification of the risk and then taking steps which are designed to obviate that risk?
Yes, or otherwise known as mitigation, I think.
Mitigation, yes.
Yes. Sorry, I've distracted myself by looking at the next point, but we've covered that one.
Well, let's go to the next point. You mention also the Hillsborough Law campaign.
Yes.
And in particular, in that context, you talk about a duty of candour. Now, obviously, the implementation of the bishop's, and I regret I've forgotten his name, but the bishop's report on into Hillsborough has been in the news again this past week.
It has.
Again, can you explain to us what you see as its significance for either this inquiry or indeed the general approach to lessons to be learned?
We've seen through the history of the Hillsborough saga a number of occasions in which conclusions have been reached based on information available, only to be found later that other information that cast a different light was known but was not made available. It was covered up, it was kept quiet, it was hidden from public view. Now, anyone who's being paid out of the public purse, an example's paid MPs, MSPs, Cabinet Ministers, Secretary of State, civil servants, any of these people, when something happens and an investigation is launched and they are asked what they know about a particular topic, it shouldn't be for the interrogator to ask just the right form of question to get a response. These documents that are relevant should be produced, that the holder knows to be relevant, should be produced and made available to the complainant. And we've seen it in a number of different ways. The post office scandal, I know it was privatised by that time, but the post office scandal was another one where I think everybody that worked in it knew that the software was deficient and the software was generating false imbalances and people were being accused of stealing that money. And all the time it was the system. But people that knew about it kept quiet about it, and a lot of people suffered because of it. I think that there just needs to be this general openness and honesty, as an old-fashioned word, that when if you're in one of these positions and you're asked for information, you don't sit on it. You bring it forward. You don't hide it. That's kind of what I mean by, as my understanding of the Hillsborough law. But of course, it's not going to happen yet. we read the other day.
Finally, on your lessons to be learned, you refer in paragraph 108 to it's not a dichotomy, as you put it. And the question is, are you going to protect people's health or protect the health of the economy?
Yes.
And you say that you can't do one without the other, and in particular make reference to long COVID. Again,
Yes.
can you just explain what you're driving at there, please?
Well, I think we've seen some evidence of the consideration is, do you go for maximum protection of people's health and let the economy suffer, or do you protect the economy and let people's health suffer? And I don't think that's a real balance. I think you have to do both. If you don't have a healthy population, you won't have a healthy economy. And long COVID is a great example of that. That we've now, because we let COVID run loose into the country and let it run loose, there are now 2 million people suffering from long COVID who are not as economically productive as they once were and may never recover back to that level. And that is an ongoing cost to the economy in the future, because these people need care, they need looking after, they need support. Whereas previously they were contributors to the economy, they may end up as being net receivers from the economy. So I don't think it's the economy or the health. I think you really have to do both. That's, I think, the point I make there.
Thank you. You have hopes for the inquiry, and in paragraph 109 you begin with referring to what your brother asked, what I wanted when you became a member of the Scottish COVID Bereaved group, and you said that you wanted to make sure that this does not allow to happen again.
Yes.
You then go on to make a comment about the care system in this country and the necessity to make the distinction between a care home and a nursing home. You say you don't think that is widely understood.
No,
Can you explain that, please?
I think I used to hear it when I went into my dad's care home, and I heard it in my mum's care home as well, that people would refer to carers as nurses. Well, they weren't nurses, they were carers. A nursing home needs to have, I think, at least one registered nurse on the staff. I'm not sure what the requirement is to provide shift cover from that one registered nurse, but there must be at least one. Now, if you haven't got it, you're not a nursing home, you can't provide nursing care. That's where you have to get someone who is qualified to come in and do that job for you. That's what hospitals at home were providing in my mum's case. And I don't, but even a nursing home is not the same thing as an isolation hospital, because again, yes, they can provide intravenous fluids or whatever, or whatever nursing they're permitted to do in the nursing home, but it's still at its heart a care home primarily, with some nursing needs also provided for. It is not a place to put people into isolation. So we've really got to have a think about, in the next pandemic, where is the surge capacity going to come from? Because it's not appropriate to use care homes as surge capacity for the NHS.
The next paragraph, you refer to the construction of the Nightingale Hospital in Glasgow.
Yes.
And you make the point, as I read it, that you question what was the point of that, particularly if there was not sufficient staff to staff it.
Yes, I think I think we got a bit blindsided by watching the Chinese building hospitals from the ground up in response to the COVID pandemic. And we thought, oh, well, we can't do that, but we can repurpose some buildings and make them to hospitals. Now, there are only two possibilities here for me. One, we didn't realise when we set about repurposing that building that we couldn't put anyone in to staff it. Or two, and arguably which one is worse, we did know that we couldn't staff it, but we went ahead and converted it anyway. What? How could we have done this and spent this money and not be able to make use of the facility when it was actually converted? Did we not think about the staff, or did we know we couldn't staff it, but let's do it anyway? You seem to be doing something. The public needs to see us doing something. This is what the Chinese did. We can do a cheap knockoff version of that. What was the purpose of building a Nightingale hospital? It's not surge capacity if you can't man it.
Okay. Pandemic preparation, you say, is not an optional extra.
Correct.
Probably I don't think there's much more that needs to be said in relation to that.
No.
No. And you then in paragraph 112, you talk about the question of whether Scotland could have closed its borders on health grounds, or whether the closure of borders is really reserved to Westminster.
Well, I think in terms of international borders, I think it is reserved to Westminster, but I seem to recall at one point Scotland trying to say that you couldn't travel between the south of Scotland and Cumbria because Carlisle was a hot spot, and people who worked across the border weren't allowed to cross the border to go to work because of different levels of COVID in those two areas, and you didn't want to swap it between the one and the other. And that, I think, was permissible because it was a health matter. So this was an internal border. But I don't believe the Scottish Government had any ability to close the international borders. And I do recall at one point the First Minister had asked Border Force, because you weren't allowed to fly from Scotland, but people would just go down to Newcastle or Manchester and fly from there instead, and then come back to Scotland. And as she asked, could you intercept homecoming Scots in Newcastle and Manchester? Well, I got a fairly short answer. So no, this whole question, I don't know legally really where that distinction, where that real power lies.
But it's a question you pose.
Yes.
Finally, I think it's a non-controversial statement, which is that rights and actions must be non-discriminatory.
Yes.
How do you relate that to what you feel and what your members have reported to you?
I think there was discrimination on age grounds, people not getting treatment, but both ways, at the upper end of age and at the lower end, as we've discussed in here. There was discrimination. Again, I saw a little bit of yesterday's questions to the PM and the KC for FEMHO was asking about Mr. Johnson about institutional racism in the NHS, and he said he wasn't aware of it. And he said, "But Mr. Johnson, there was a report done on it. Have you not seen the report?" You know, I think Scotland has gone a lot further into trying to bring human rights into its legislature than the rest of the UK has done, and I think that probably needs to progress a lot further than it has. But there shouldn't be discrimination, whether it's the young lady we spoke about who needed an advocate, people being denied treatment because they were felt to be too old. That I think there's been an instance. I know when I think Chris Whitty, if I remember correctly, brought out a triage scoring system at some point, and it was quite badly received and it was quickly withdrawn. But I believe there was a period of time when some of the hospitals in Aberdeen actually used that form, and I think that's got to be part of the investigations of the inquiry as well. Not trying to tell everyone how to do the job, but I just think these are the sorts of things we need. We need something like the inquiry to delve into. Yeah.
Now, Dr. Wightman, those are really all the questions I have for you based on your statement. I offer you the opportunity, if you feel that there is something that you haven't said or would like to say, this opportunity to do that. Now,
Right.
normally, I might anticipate that would come in the form of a statement, but I think in your case it comes in the form of verse. And I think you've put together
it does.
something that you would
Yes.
like us to hear.
I would, and I will attempt to read it. But if you think you saw me weeping earlier, hold on to your hats. But I will do my best. Before I get to that, however, can I just say one of the members asked me this morning, would I please raise the topic of nosocomial infection?
Yes.
And point out that COVID has not gone away. This is still circulating inside hospitals in Scotland today. It is still causing deaths today. And therefore, anything that can be done to expedite, some form of making that better, making that less of a risk to people who use hospitals in the short term would be more than welcome. I think that's the best I can do with that for the moment. So now, yes, this is, when I began listening to people's stories when I first became involved with the group, there were many times I heard things that that were very difficult to hear. And then I kind of became a bit inured to it for a period. And I remember reading for the first time, and when I'd asked somebody, would you tell me the story of your loss? And they said, you are the first person to come and ask me about my loss. And that was so powerful. But I became a bit inured to it. And then just this year, something changed again. And I became quite aware of the way that people spoke about what had happened to them, spoke about their loss, and little phrases and little things they would say that I just wrote them down, and I think, wow, that really summarised that. And I didn't know what I was going to do with these things, but I just started to note them, and I'd leave them somewhere in the back of my mind. And after a period of time, they started coming out in the form of verse. And I'd like to read what I have here, because it's not everyone in our group that's going to be given the chance to have the privilege that I've had today to address the inquiry. And even those that have told in some depth their stories, and they're impactful. But I think there's another way to perhaps try and encapsulate some of these feelings and impacts. And I'd like to read what I have. I've called this, it has a title and it has a subtitle. And I've called it, For Those We Lost to COVID and for those they left behind. To those we lost to COVID, these are our words to you. Although you cannot be here, we are forever true. And of the ways you left us, they should not be in vain. The promise that we make us, these should not be again. You were once a Brill Cream boy, your shiny hair slicked down. I think about you often and feel your presence round. I hugged you for the last time, then everything was changed. No touch or words from you now. My life is rearranged. You fought it for so long till your strength it was all gone. Our children lost without you. So for them, I go on. If you have flu, it is not flu, I heard the experts say. I knew then what it really was, and it took you away. Your mum would be proud, the lady said, trying to make me cry. Why all this fuss, I pictured Mum, but with a twinkle in her eye. The care home staff just did not know the ways to keep you safe. So few were they had no help. We're left now with this grief. It was, you said, your lottery win told no more shielding for you. But COVID took you off from me. I can no longer hold you. But I recall on our last cruise the way you dressed, your smile. Although we're separated now, I'll see you again in a while. I once had thought to understand the true depth of such grief. But now I know I did not then and find little relief. Together we supported your beloved football team, and in your name I support them still. With you still there, I dream. The first year was just as tough as I knew it would be. The second year confirmed this now, my new reality. My brother, you survived the stroke that kept you locked within, denied the jab against COVID. That fight you could not win. Dear uncle, I recall your voice, your singing and your smile too. Down syndrome may have walked with you, but it did not define you. Two young men each sought advice from assessment hubs so dismal that COVID virus took their lives. Their triage was abysmal. An elderly husband was discharged with COVID to his wife, who sadly then caught COVID too, and they each lost their life. This month was once my favourite, till it took you from me. But now I do not love it. It will not leave me be. You always were the main one that I depended on. Since COVID took you from me, my safety net is gone. Her very handsome husband had made her future bright. Since COVID took him from her, some days are dark as night. My friends ask me, how are you? But they don't want the truth. Some now no longer know me, though I've known them since our youth. They took you into hospital to make you well, they said. But in there, you got COVID, which took your life instead. All rules were followed at all times, the UK Prime Minister lied. Inside number 10, they danced, drank and sang, while we at home complied. The legal team supporting us, we instruct to enlarge on questions that just must be put to those who were in charge. And of the ways you left us, they will not be in vain. The promise that we make is, these will not be again. For those we lost to COVID. Thank you.
Oh, thank you very much, Dr. Wightman. Thank you for being able to get through that.
Just about.
Appreciate that.
About.
Thank you very much for your evidence.
Thank you.
Very good, that's all for this evening. Tuesday, 10 o'clock.
Thank you, my lord.